Right, well, good morning everybody and welcome to today, the 20th of July's meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny Panel. So first of all, I'd like to welcome everybody to this meeting, and I would now like for the panel to introduce themselves, and then when officers are speaking, and if we've got any public speakers who are speaking, for them to introduce themselves when they when they are talking. So my name's Dina Romero, I'm a councillor in Southdown and I chair this panel. Liz.
Good morning, my name is Liz Hardman, I'm councillor for Poulton and I'm vice chair of this committee.
I'm David Harding, I'm ward councillor for the Chew Valley.
I'm Michael Orton, I'm ward councillor for Midsummer and Alton North.
Hello, Councillor Joanna Wright, Lambridge Ward.
Leslie?
Good morning, my name's Leslie Mansell, I'm councillor for Radstock Labour and Cooperative Party.
Thank you, and then Kevin and then Christopher.
Good morning, Kevin Burnett, Professional Association representative and a non-voting member of the panel.
Good morning, Christopher Batten, representing National Education Union, non-voting member.
Thank you, everybody. Have I missed anybody out on the panel? In that case, then I will turn to those that service our panel. Mark.
Good morning, my name is Mark Durnford. I'm the Democratic Services Officer for the panel.
Morning, I'm Kerry Williams and I provide Scrutiny Officer support to the panel.
Well, thank you very much, everybody. I'm now going to ask Mark if he would like to talk us through the emergency evacuation procedure.
Yes, no problem, Chair. If the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, we follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant. And there's evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated a safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you very much, Mark. And do we have any apologies for absence and or substitution?
Only one apologies that I'm aware of, and that's Councillor Onkasini.
Thank you. I'm going to also add Councillor Crosley to that list, although he may arrive late. Thank you. Okay, next item is declarations of interest. Do I have any declarations to be made? No? Okay. Right. Urgent business as agreed by me. So as you may be aware, in fact you all will be aware, we have referred the decision by BSW ICB, sorry, that's not quite true. We have referred to the Secretary of State the BSW Hospitals Group call-in. We have received responses from the Secretary of State, and we have called it in twice now, and this is an issue that I will continue to be taking up with the RUH. I have a meeting set for Friday, and I've invited the Vice Chair and our ICB representative to that meeting too, and so we will report back from that meeting. You will also be aware that we previously, I think maybe even over a year ago, called in the BSW ICB's proposed change to community-based care in Bath and North East Somerset because they had decided to appoint HCRG to run those community-based care services, and we have only just received a response from Karen Smith, who was then the Minister of State for Health, and that response was received on the 24th of June 2026. So quite a significant time since we actually made that call in. It might be something we might want to raise with whoever is going to be representing the government on health. I think decisions on that are being taken today. That call-ins need to be addressed slightly quicker than over a year. Leslie.
Yes, thank you, Chair. Just on that point about the length of time it's taken and also the call-in process, looking at the responses, both of the responses, it just concerns me that this system doesn't seem to work. So I think if we can refer this to whoever we refer it to and ask them to have a look at that, because in the case of the first one, the HCRG, it said you can only call in on these for these reasons and then dismiss a second one, although we use those same reasons. And I think if there's one of the few things we can do on this panel is to ask for the call-in, because we can't call it in ourselves. So if that process is not robust and transparent, then it's not working. So it would be really helpful if we can escalate it through the appropriate channels. Thank you.
Thank you, Leslie. So it's something we can raise through the Centre for Governance and Scrutiny. It's also something that separately we can raise as, you know, in a letter, in some correspondence to the Secretary of State, or to the Secretary of State's office, at least. Lucy.
Thank you, Chair. So at one of the recent scrutiny meetings, when we discussed the BSW Hospital Group decision around the bank, we did suggest that we hold a scrutiny workshop for us to work with members for clarity on that process. So appreciating Councillor Mansell's comments around the delay with that particular issue, I wanted to ask today where we are with planning that session so we can get the clarity on what is the role of scrutiny in relation to that process and what things are subject and not subject to that process, and how we would want to deal with things that are important but might not sit within the Secretary of State call-in regime. So I just wanted to check in where we are with planning that workshop. Thank you, Lucy.
I know that it should be on our work plan, but I'll just check with Kerry and Mark that is the case, and we'll certainly be circulating some dates. Okay, Kerry's just quietly nodding at me. That's good. Thank you. Okay, so we now move on to the next item, which is public council statements and questions. I don't see any members of the public, and I've not been alerted to any wishes to speak. So then we move on to the Cabinet Member update. Obviously, you have already circulated this report, Councillor May, so we're very pleased to see that. Is there anything else you wanted to add that's might have happened, or anything you want to emphasise since the report was sent?
Thank you, Chair. I'm Paul May. I'm the Councillor for Pensford and Whitchurch Village, and I'm the Cabinet Member for Children's Services. In introducing the report, I think the major issue I want to raise is a big thank you to staff. We had a SEND inspection, which I've reported in my report, and we had to get the reform plan that had to be produced for the Department for Education. Both happened to be on the same day of the feedback from the joint Ofsted CQC inspection and that report going in, which meant that we had to work very, very hard. When I say we, I mean the officers had to work exceedingly hard to actually achieve that. In addition, there's things going on around the regional care cooperative, fostering hubs, a whole range of national schemes which are putting officers under intense pressure. So it's probably unusual for me to start off by just saying a big thank you, but I've seen the tension and the commitment that we've had from senior officers of Bath and North East Somerset in achieving those deadlines. And I think formally on the record, I would like to actually record that if I can, because I think it's been exceptional. The the ideas coming from government are, I think many of them are welcome, but it is a question then about then that goes to the Department for Education, and then all the deadlines are set, and that then puts quite a bit of pressure in making sure. But the reform plan, which I've made reference to there, that's not a political document, that's an officer document. And we worked very closely around the timescales because we had to get agreement from education, the maths, schools, parents, from the Parent Carer Forum, and of course from health. And health with the latest cluster, which covers BSW, Somerset, Dorset, Bournemouth, Poole and Christchurch. That was a terrific logistical problem for health in actually being able to approve our plan as well. So it's been a really tight deadline, and even the deadline was set in such a way that we even had to take it to Cabinet after we'd made the submission. But I've got the document here. I mean, it's a massive task that's been done. And the end result is really important for the council, because if our reserves, our statutory override around SEND is something like £40 million, possibly even more by the end of the 2028 deadline, then that's going to be a major issue if we can then get 90% of that funding back. But that's subject to our plan being approved by the Department for Education. So that then is likely to be something in September before we hear from them. And otherwise, I think I've got a good team supporting me this morning, and I'll take any questions and probably refer them on, Chair. Thank you.
Thank you very much, Paul. I think we would echo your thank yous to Jean and her team for getting these types of responses done in such short periods of time. I don't know whether or not there's anything that can be done to ensure that you get a little bit more time to do these things instead of everything feeling like it's got to be done instantly. But anyway, that's another matter. Now, Jean, I know you want to speak.
Thank you. So Jean Kelly, Director of Children's Services and Education. Just a couple of things to update in relation to the briefing. In relation to the Regional Care Cooperative item, which is item 2 on Councillor May's report, we did say that we would update if we'd heard the outcome of the bidding process for the additional opportunities that the DFE had offered. The South West region was unsuccessful at this time in being one of the successful regional care cooperative bids. So we continue to work with everybody in the region as part of the Children's South West Alliance, and we continue to build our work so that the next time we get the opportunity to bid, we will do that again. We have not had feedback yet to our bid as a region. The South Gloucestershire lead our South West Children's Alliance, and they led on the bid, obviously working with all of us, and they are getting feedback tomorrow, so we will know more tomorrow as to why we weren't successful as a region. And then the second thing I wanted to update on is the SEND inspection. So we have had the draft letter. It is embargoed until the final letter is agreed. We received that a week before last, so Friday before last, and we have until this Friday to accept or ask for any factual accuracy changes, or indeed make a complaint if we're unhappy with the inspection report. We are busy working on that, and we'll complete that this week in order that CQC and Ofsted can publish that report as soon as possible. But with the holiday period coming up, it's unclear as to how that will be managed, and as soon as it is available, obviously it will be publicly available for sharing. But we've tried to give as much feedback via Councillor May's briefing as we possibly could.
Thank you, Jean. Okay, do we have any comments or questions? So I'll start with Liz.
Thank you, Chair. It's good to know that the SEND reform plan will be coming to us when it finally is publicised, and I assume we'd get a report, say, in the spring. And with the area SEND inspection, again, we're going to get a report of that later on. But I would like to ask a question about the SEND inspection, and it said, inspectors concluded there is a strong platform for future improvement. So what does that mean? It sounds like a euphemism for a lot of work needs to be done, especially when they concluded that the principal challenge for the partnership is ensuring greater consistency in the experience and outcomes of children and young people with SEND. So if they're saying something like a strong platform for improvement, what exactly is meant by that? Thank you.
Thank you, Chair. Very simply, about, I was going to say 3 years ago, SEND in Bath and North East Somerset was in crisis. We've got a new manager, and that manager has come through to this committee on several occasions, and we've made lots and lots of positive improvements. But as presented by us, and as expected, the outcome is likely to be that we're on a process of absolute improvement. And under those circumstances, it's important that we actually recognise that what they're saying is correct. It's not perfect. And what we want to do is we want to improve. We are improving. And we gave a forward plan of how we were going to improve. And they've reflected that in their comments back to us. So it's not a bad situation, but it's not perfect. And you wouldn't expect us to be saying it was perfect because the system has been broken for quite a while. And the changes that were taken by the previous government set a system where there were so many children coming into the system, it was really difficult to handle with that volume. That doesn't say that those needs of those children isn't there. It's just that in terms of how the bar was raised under a previous administration and the changes that we're talking about elsewhere in the report that the government are bringing in, Families First, etc., they've also taken over the funding of SEND from 2028. So in terms of what we were expecting, I think it's exactly what we were expecting from the feedback from the joint inspection. They've changed the rules. It's not outstanding, good, requires improvement, etc. It's now going to be 3 categories, but it will actually identify, I think, in the report that we're making good progress. So it's a basis that we're moving forward in a really sensible way. And I think that's a great credit to the officers that they've actually pulled that around in a relatively short period of time for such a major challenge that was just a few years ago.
Very much, Councillor May. That's a really full answer. Thank you. One last question from me, and it's about alternative provision, which has been planned by us for Abbott Alphege. Now, the Hertz school is there already, so what will happen to the Hertz school with this alternative provision?
Chris, who is going to introduce himself?
I am indeed. Chris Twilford, Director of Education. The hospital education provision is planned to move down to a building located on the site of Western All Saints Primary School. That is due to happen shortly.
Thank you. Can I just also add, Chair, that location is absolutely fabulous. At some stage, I hope, when we've got everything sorted, we could organise a visit for members to see it, because it was a really, really nice school, which closed because there wasn't the demand there for it. And the conversion of the buildings has been really important because you've got 2 levels and you can make it adaptable to the children that are going to be there.
Perhaps that's a lesson for future as well, that if we build new schools, indeed any building, that they have the potential for adaptation in the future as well.
I don't know how to answer that, Chair. But, I mean, the simple fact is, in terms of place planning, it is really important because numbers have been going down. And in my area, there was a large development of 200 houses. There was a half form put into the local school, and that form hasn't been filled. so that there is an issue around when you're talking about local plan, whether you actually provide Section 106 agreements for schools and how they're actually occupied in the future.
I'm sure some of this detail will be useful to pick up when the local plan is being discussed and when we're consulting on it. I think from September onwards. Anyway, that was more of a comment. Kevin, did you want to raise some comments?
Thank you, Chair. I think first of all I just want to reiterate grateful thanks to all the officers and all the work that's been put in. I did mention, I think quite a while ago when we were in the safety valve, what good work and how the basis for future was there. And that we should have carried on with that good work regardless of what the government was going to do, because we knew it was the right thing to do. Two comments, really questions. One was around, you mentioned in your report, Paul, that the priorities that the inspection picked out align very closely with the SEND reform plan. Just to check, there were no other surprises that you hadn't anticipated that came out as an issue. And the second point was around probably a comment that you made towards the end there about, and the chair, around future sort of proofing schools and buildings, etc. And whether the Children's Services are now looking at how, with the SEND reform plan and the need for inclusion bases and resource bases, has a mapping been undertaken now of all schools in Baines and looking at numbers and where those things can happen? Thank you.
I'll pull Chris in for any detailed response to that, but I do see that when we're talking about these things, the capital investment, there's been capital investment into bringing SEND into schools, which I think has been quite successful. Not all schools are easily adaptable, but where we've had a forward plan on doing that. So I think that's there. In terms of future-proofing of schools, I'm a cabinet member. I'll pass that over to Chris Wilford if I can, Chair.
Thank you, Chris Wilford, Director of Education. With regards to the capacity for mainstream schools to deliver inclusion bases, in the government's white paper and in the vision for the SEND reform plan, it wants every secondary school to have an inclusion base on site. Inclusion bases can either be specialist bases, which some of you will be familiar with. They're what we have been used to calling resource spaces, so quite specialist provision for children with specific needs, which allows schools to admit children from other schools with the HCPs onto site. And Baines has got a strong track record of recently developing more of those resource spaces. Currently we have a number in development, which is going to provide additional capacity. The government is also asking all schools to look at creating support bases, which are specific bases on their secondary school sites, which might support children with different needs. So you might create a support base for children with emotional-based school avoidance. You might create a specific MLD, mild learning difficulties, support base on site. For primary schools, the reform plan and the government's direction is that all children who need access to a support base should be able to have access at a primary level. So what we've been doing as part of the reform plan process is mapping all the capacity and provision that we've currently got in Bath and North East Somerset. We've been looking at the school estate more broadly, so where is there space, where we can develop more, where are there particular, know that there's going to be growth areas, so we know that we've got to ensure that we retain space in schools. And we've done a audit with all schools about what their existing provision is, and what we'll be doing next is looking to map that against where we think we might have gaps or particular needs, and working with the multi-academy trusts around ensuring that we're developing the provision within the area of Baines, so that we've got a rich and broad offer that meets the Department for Education's requirements, but also is specific to Bath and North East Somerset. We've got a representative from a multi-academy trust who's helping us with that piece of work, we will then start to look at building on what we already have. Obviously, some of these schools were built some time ago in Bath and North East Somerset, so some schools lend themselves easier to adapting than others. We know we've got some schools where they have got capacity on site, so we've been working with those. Where we can create additional buildings, we will. But we have to be mindful that the capital receipt that we've got from the Department for Education won't allow a new build on every site, so we do need to look at where we can repurpose existing provision. The good news is, through the mapping that we've done, most secondary schools in Bath and North East Somerset already have a support base on site. So what we're doing now is looking at the very best of the expertise that's out there to see how they could be run by schools. So we've been working with colleagues from across the southwest region to look at what trusts have been doing in that space, and we'll be looking to deliver those support plans and resource bases in the way that Department for Education and Reform Plan wants all the duration of the 3-year reform plan.
Yeah, thank you. There you are, Kevin. I said that Chris would give you a fuller reply. Can I also then just draw to the item 5 in my report around Charlton House? Because Charlton House is another example of where we're putting capital investment into not only SEND, but also children's care. It was a building that was in, I was going to say, that part of Keynsham over there, and it was is going to be converted. It'll be ready for 2027. So it's both education and children's home. So that then also starts to pull together some of the work around the regional care cooperative that Jean was mentioning, because we have a real issue in Bath and North East Somerset around children's care, around sufficiency of placements. So we've been supporting that initiative of the regional care cooperative, really important for us. And we are working carefully with South Gloucestershire Council, because it is a real issue for us. And it's a shame that it didn't get approved, but the need for us to work together around that sufficiency of places is really important. And I think under those circumstances, we should also then pick up the issue around Culver Hay, because we've talked about the AP provision. Originally, that was going to be provided on the Culver Hay site, but when we needed to make the temporary arrangements at Abbott Alphege actually were much better than were being proposed around Culver Hay. But the Culver Hay development is still there with the DFE. We were given the choice of having a bit of money or having the school built. It's been approved by the DFE, which I think is really good, by the Minister. But it's now just a question of getting the timing of actually getting that provided. But that's special needs provision at Culver Hay. Abbott Alphege is about alternative provision, and the issue about how we actually get better sufficiency. Building a big children's homes is not the solution. Getting children's provision that is suitable for the child is actually the way forward for us moving forward. So I think my report, a lot of that is we're in a period of great change, and I hope today they don't change all the rules again. But there's lots going on which I think are much better for children than have been in the past, and that's where we get all the support from the officers to try and make these things happen in the best way we can for children.
Thank you, Paul, and thank you, Chris. Kevin.
Yeah, thank you, Chair. Just on the last point, Paul, around Culver Hay, you mentioned. So can I just clarify my understanding that on the Culver Hay site is greenways, or will be greenways, and at the moment nothing else because AP is going to Abbott Alphege. Have you thought, or is there a proposal now for what might actually else go there on the Culver Hay site?
I've been very clear politically that the commitment was given by this council that we would have education on the Culver Hay site to the communities that are in that area, following on from the ending of BCA. and I think that that's been my priority. At some stage, when the initial assessment's been carried out by the DFE around what the school and what other provisions will be on site for the public, then that will then be for another committee to be looking at the use of that site. But at this stage, I've been very, very focused through Cabinet, through to the Council, that we've got to get education onto Culverhay site. So at this stage, I can't answer your question, and I would say quite positively, it would be wrong if I did answer your question, because we've got to see how much the Culverhay school plus the other provisions that the public might be able to use will take of that site, and then it can be considered probably by another committee.
Thank you, Paul. And
Chair, can I just come back? There's also the property people, but they're going to be pulling down the Culverhay site, have made a public commitment that if there are people within Twerton or ex-teachers who want to come back, they're going to be organising in early August for visits to that site. There'll have to be visits that are controlled, because the site, parts of the site are quite dangerous. But we'll be carrying out advertisements and public relations around that in a short time.
thank you, Councillor May, and that picks up the point. One of the points I was going to ask was about that commitment to allowing ex-pupils, you know, those that still live in the local community, and teachers, etc., and anybody else who had an interest in that site, that visit. Can I just stress it would be, you're talking about early August, obviously August starts next week, so I think the maximum amount of notice, I think, would be appreciated by all that wish to make that visit. Right, so on my list now, I've got Leslie, David and Joanna.
Yes, thank you for the report, Paul. And I think, again, it doesn't really show the work that's gone in to get us to this point in the council. So do recognise the work all the officers and staff have put in. On the SEND reform plan, can I ask when we can see a report on the outcomes of the actions within the report? So we haven't seen it, so we haven't been able to scrutinise it, and I thought that was our role. Also on SEND, the government very much wants to focus on co-design. So when we're looking at each EHCPs, how can we consistently capture the voice and aspirations of children to make sure they're really relevant? And I would like to come back on another issue as well. Thank you.
I think you may have already answered Leslie's first question when you were answering Liz, but...
Yes, I think I may need to take further advice on that, but the simple fact is that if the plan is approved, it's a plan to deliver, and we have provided is it a 12-month plan for the delivery? Chris, can you just give us the detail?
In actually being able to see the report now, it's actually published as part of the Cabinet papers, so what we can make sure is that a link goes out today, so get round so you can all have a look at the report and the action plan, so it's there to be seen. With relation to the views of children, young people and parent carers, the delivery of the reform plan is going to be based on the premises of how we start to not only build on the work that we already do to capture the views of children and young people and with parent carers, but how we make it central to how we deliver the reform plan. Part of the government's education white paper is around rebuilding some of the confidence that parents have in the local education system. So in delivering the plan, we have set up a working group, and on that working group we have provided additional funding to our parent carer forum so that they've got 2 days a week to help us deliver the reform plan. And the focus of that role will be around parental confidence, voice of children and young people, and voices of parents and carers in the local system to help us deliver that plan in line with the aspirations that we have locally, but the aspirations of Department for Education.
And Chair, on the co-production side of that, the Parent Carer Forum when we had the SEND inspection, were really, really positive about how things have changed in a relatively short period of time. We've got a memorandum of understanding now that we've worked through with the Parent Carer Forum. We've got a working better together a team that picks up SENDIAS and Parent Carer Forum, and we meet on a regular basis moving forward. So it is something that I think where we've seen SEND inspections up and down the country, one of the major issues is the bad feeling between parents and officers. And here I think it was openly acknowledged that we actually have changed and we are working well now with our Parent Carer Forum. And I know that Jean meets them on a regular basis, and Chris does, Laura does, and I do. So we actually do work very hard with our Parent Carer Forum. And it's not just one person, not just Rachel when you've seen her come along, and you've seen when she's been along to this committee. She's very firm, and I, as a councillor, actually appreciate the independence of view that she's got, because sometimes when you're in a role like this, you can just hear from one side, and I think that co-production is really important. So I think we've gone a long way towards improving how we're working. Still got further to go, but I do think it's actually important for us.
Thank you.
Not for us, for the children.
Yeah, I was going to hope that's what you meant. David and then Joanna.
Sorry, Chair, I just wanted to come back on another point.
Okay,
So
very quickly.
this is really in relation to the Family First and the new structures. So for me, what I see within this is there's going to be training, workforce development, new practice expectations, which is really positive. What I am concerned about is there's been yet another report, this time through the BBC, regarding sexual abuse of children. I think later on we're going to look at the Youth Justice Plan. And what was coming out of this report, that 1 in 5 girls are sexually abused and 1 in 10 boys. It's not anything that's that's reducing in number. Unfortunately, it's growing. So my question is around what training will there be, increased training on recognising child sexual abuse indicators, and to ensure that we can embed models that try and tackle this. I say try because I know it's not as simple as it sounds. And talking to social workers, I've asked them what training they have, and they say, well, we have some, but we don't have enough. So that's my question. Thank you.
Thank you, Leslie.
Sorry, can I, it's a bit out of my my
I
knowledge.
think Jean was going to pick it up
Yeah,
anyway.
thank you.
Paul.
So I think the issue in relation to child sexual abuse, and that covers a whole range of abuse, whether it is child sexual abuse within the family environment, so that's intrafamilial, or whether it is extrafamilial via sexual exploitation in the community. So it is a big set of issues. There have been a number of reports published, whether it's about gang grooming recently, or whether indeed it was the National Panel's report about child sexual abuse in the family environment. I wanted them all to notice. We held a conference quite recently in Baines. We invited partners to come to that conference, and it was specifically about our response to child sexual abuse in the family environment. That I think we had about 150 colleagues who attended that conference here at the Guildhall. It's something that we have a high priority in respect of, because we are absolutely clear that child sexual abuse is happening at the kind of prevalence that Councillor Munville has noted, and we are also concerned that all partners need to make sure, that includes social workers, but not exclusively social workers, are able to identify, to recognise, identify and name concerns about child sexual abuse. That National Panel report really spoke to the range of dynamics historically and currently across the country whereby children's experience of sexual abuse is not necessarily named. We often identify neglect or emotional harm, and so other types of harm where children might also be being sexually abused. So training is really important. I absolutely appreciate that colleagues will say there's not enough. There are a whole range of areas where we have to provide training for our practitioners and our managers, and there will be cycles of training available, and we have to make sure that that covers all of our staff who are practicing with families and children in order to hear them and to understand what they're experiencing. So I take away the comment about there's not enough. We will think about that with our service. But there's also partnership training. So the BCSSP provide a training programme as well for partners. So that's the BANES, Community Safety and Safeguarding Partnership. So there's also training available via the partnership for practitioners and managers.
And before I bring Paul back in again, I was just wondering whether or not this was, whether some type of training could be made available to counsellors who are also often engaged with different families and might have concerns, but also might need to just be aware of what signs they might wish to be looking out for as well. Paul?
I think it's a good challenge. Recently we were talking to the child exploitation group as well. I think it's a whole range of things, and no lot of detail being given by Jean, but I think I ought to bring it back at another meeting a bit further about this, because it is an important issue, and again it crosses partners, police. We've got the youth justice plan in a minute as well, but it's a whole range of things that we do need to actually think about how we can deal with that as effectively as we can. And I think, Jean, will you be quite happy if I bring that back at the next children's meeting, if we could put that on the forward programme, Kerry? Thank you.
That I think is October, I think. Yeah. Lucy.
Thank you, Chair, and agree with Jean, Councillor Mansell. It's a really helpful, prompt question. Really keen to work together on that update. From a health perspective, we not only commission local services with local training, but we also commission the Specialist Centre, which is in Bristol, who also provide training. So I think we could work together on what the plurality of training offer is for this really important subject.
And as I said, I think it might be helpful to include some form of training for counsellors as well. David and then Joanna.
Thank you for your report, Paul. There's lots of things to be optimistic about in here. It's really good. And clearly a huge amount of work has gone into this. One area identified for further development was including reducing waiting times in CAMS, neurodevelopmental assessments and community paediatrics, which is obviously, bulk of that lies with health. So it's kind of out with your remit, etc. I was just wondering how that's gonna work, whether we need someone from those services to come and give us those reports, or even from the ICB, because clearly part of it is down to funding of staff.
Well, I don't know whether to take Lucy or Jean first. So both put their hands up at the same time.
Say something general first. So the CQC and Ofsted inspection really is looking at three groups of organisations or agencies or interested parties. So the social care element of Ofsted is thinking about social care and how we have performed. The Ofsted schools inspectors are really focused on education providers. So there will be recommendations for social care, for education providers, and of course our health colleagues, and Lucy's here. Lucy and I were very much meeting with the lead inspectors during the inspection. We'll obviously have a range of health recommendations. So we work together in terms of any action plan that we need to present to the inspectorates, and we'll have a period of time, once the report's kind of formal, we have 35 days to pull together an action plan that then we submit to the inspectorates for their consideration.
Thanks, Chair. Thanks, Jean. As Jean's described, we continue to work very closely on the recommendations. I just wanted to give some context. So from a ND pathway perspective, which is commissioned through HCRG, we actually have very competitive waiting times compared to the national average, but we've acknowledged that those waiting times are still too long. So, for example, no children in Baines are waiting over 52 weeks. As I've said, we know that some of our waiting times are too long, but compared that with some of the national waits, which run into many years, our focus has been on recovering and reducing those waiting times, as well as introducing the new process for referrals, which means children, young people and families and schools can self-refer into assessment, which has cut the pathway down. In terms of CAMS, there are a number of waiting times for CAM, and within the report recommendations, we've been working with which are the areas that we need to focus on. So we're very happy to share for a future meeting the position on waiting times, because it is varied, and in fact some of the access times for Baines children and young people are actually very competitive, but also acknowledging the areas where we need to spend additional focus.
Thank you, Lucy. So does that answer your question, David? Or?
It would be good to see some of that work. I mean, competitive, of course, to national averages or whatever, doesn't necessarily mean good enough, as we all know. But so it would be good to see how that work's going and where things are being improved. Thank you.
Chair, can I just, the CAMS contract is with Oxford Health, and I'll perhaps talk to Lucy at some stage of whether we can bring Oxford Health along to the committee, because we've brought the DFE along at various stages, and I think it is such an important issue. It might actually be, I haven't discussed it with Lucy, but she's nodding. So, but I do think it would be worthwhile for the committee to actually have that, and I think it was a good query. Thank you, David.
I think we would all agree. Lucy?
Very happy to do that and speak to Oxford Health, colleagues, Councillor May. I think the other thing we always remind people when we talk about CAMS is one element of a service for children who meet the particular requirement to have their needs met by a statutory health service. We also have a lot of children and young people who have emotional well-being needs that are met by really good third sector providers such as Off the Record. So I think if we bring something that shows elected members of this panel the shape of what the offer is and how we're performing in relation to access to those services, but we do it as a total, because every time we segment out areas of the pathway, we're not demonstrating actually how we're meeting needs for the children and young people who need it in the best way that they can receive it.
Thank you, Lucy, and I think we'll take that away and form a future agenda so that we can have several contributors on this and around this issue. Okay, Joanna.
You're pressing the wrong button, sorry. Thank you. Thank you for your reports and for the many questions already asked by the panel, some of them that I had listed. My concern is that I know that tomorrow we have corporate policy development scrutiny, and the information about Q1 and the finances of children's services haven't come into this report, and it's quite clear that we seem to already be over budget in the first quarter. The problem with corporate PDS is they rarely give information about previous years, so it's very hard to gauge, but every year we do seem to be over budget. And this is a clear issue that comes back to this panel later in the year, and then we all get, oh, we should ask and do something. And then we have the budget and we all sign everything off. Can we ask that in your report and also in Councillor Bourne's report that we do have some detail of the budgets of where you are for each quarter, so that we as a panel can make sure that we are up to date on that? Because at the end of the day, you are meant to be putting in place certain things and have them done. And if that's not happening, then we need to know why. And it seems like every year we're in the same place, that we're over budget at the same points on the same issues. So we need to know why that's going on. It's interesting to me that we know the school numbers are coming down and we're going to have empty places. And we also know that the SEND needs are going up. But there's a mismatch. And I certainly know when I speak to parents and hear conversations about schools and conversations about children, that there is a desperate need in schools for just the basics. I've heard about how in one school the head teacher and the deputy teacher are doing the school dinners. So I am hearing all this stuff about the wonderful things that we're going to do with SEND, but the reality is most schools are just managing to get by, and they're putting together school groups closer and closer together so that they can just manage things in a way that they didn't used to have to, which is not your fault at all, and it is where we are. But I think there needs to be a bit more reality check about where we are with our finances, where we are with the provisions that are actually going on, and how that mapping takes place. So that is probably one of my main questions. I also know that there's been a school boundary change, and that's impacted lots of young people across Bath and North East Somerset. I've had lots of parents contact me on that. I wasn't aware of it, how that happened, what has happened there, and where will that also impact how things are taking place from all the information that you've given us today. So I think there's a lot there. And going back to provision of looked after children, we know that that is one of the council's major costs. So to have some costing in these documents for us at this meeting, I think is really important. And I'll back the mandatory training, I think, should happen for councillors on how to protect children. I think that's a piece of work that we desperately need. Thank you.
Okay, Chair, I'll try
Yes, please.
I think the Children's Services, this committee has a presentation from Darryl around the budget every year. If there was issues where budget funding was not covering our needs, I probably would bring it back, but I don't think it's appropriate for this committee to be getting a budget report. I meet with Councillor Elliott every 4 weeks to actually go through the council's budgets around children's services with the Section 151 officer, with Jean, often with Paul and Chris as well, where we actually stand back and look at the budgets for the council. But this council has always been, and I'm proud to say it, has always supported children's services. In other areas, that's been a real issue, but in this authority, we've used the finances that we've got. We've got the advantages of heritage, which has helped support the funding for children's services. And if I thought there was an area where a service was being put to a deficit in terms of the budgets, I think I would bring that back, but I don't think it's appropriate that I bring a finance report every time. I do think, and I've spoken to Jean about this in the past, that we perhaps could bring more performance statistics in my report, but with a few other things going on, that's something on hold moving forward. In terms of the schools, of course, the funding for schools comes through the council, but it goes out to the schools, and that we're with 97% of our schools being in multi-academy trusts, and the government stating that they want basically all schools to be in trusts. That's something that is really quite difficult. But the national formula, which was brought out a couple of years ago, in actual fact did work to the advantage of schools in this area in comparison with other areas. So because we were quite badly funded in terms of school funding. So I think that's got better, but it's like always, you know, there's never enough money to do everything that you want to do. But I think at the moment I would take advice on your query, because I think it was a reasonable query, but I do think that if we start spending our time here talking about money as opposed to talking about the services we're providing for children, I think that would actually be a backward step.
Councillor May, I would challenge you back on that. I'm not asking you to look at the money. I am looking at the performance. And as the non-executive, our job is to challenge the executive on what they're doing. And if the executive is year in, year out over budget at the same point, then we need to know that and ask questions about how they're delivering that service and why that's taking place. And that is a reasonable request from this committee.
Paul, I don't know if
Yes, sorry.
Jean wants to come in, so that might be helpful.
I think I think it's really helpful for this committee to understand where our pressures are, and they are primarily in children's placements. So, and I think that this committee should have information about our children, the children that we care for population, and how that has developed over time in terms of numbers. There's been fluctuations, but we haven't had the significant rises that other local authorities up and down the country have experienced following the pandemic. However, what we have experienced is the increasing cost of individual care packages for children. And so while there might not be a significant number more children, those care packages are incredibly expensive for some children. And of course, as a demand-led service, we will work to meet those needs where children need to be looked after outside of their families for however long that's necessary. We will do that while exploring real opportunities for them to return home or to be cared for by kinship or connected carers wherever that is possible. The issues about placement sufficiency are national. We are really struggling locally. So you will have seen in previous reports to this committee when we talked about placement sufficiency, the number of children that we have to place more than 20 miles from the authority, the number of children that we have to place in residential placements that are spot purchase, that's individual contracts with those individual providers. And there are concerns about the profits that those organisations make. The Children's Wellbeing in Schools Act has legislated for this, asking independent providers of children's care homes to report annually to the Secretary of State about the profits that they're making as part of a journey to try to curb some of those profits. While we are where we are, we have to make use of all of the potential placements that we have. We do not have sufficient fostering placements either in-house or via independent fostering agencies currently, and we are working hard to improve that, but it takes time. And those children where we are experiencing those pressures, we're clear that we need to look after those children. We have plans for those children. And what happens is, from year to year, those costs follow through. So some of that pressure follows through from one financial year to another. And that's where you begin the year with some of those pressures. And where we haven't been able to change plans for children in a timeline that we thought we might, because their needs change and plans change, and there may not be sufficient placements to make the change that we'd like to. We end up with ongoing pressures in respect of that. So I wanted to say something about that to you sort of very directly as a response to your question, because I understand where the question comes from. And I have officers working incredibly hard, day by day, to support children to be in the right care setting, or indeed to live with their families wherever possible.
Thank you for that. I appreciate that. And I guess that's what I'm expecting there to be in each quarter for us to then examine, ask questions about as a non-executive, and that's our role. Thank you.
And perhaps this could be picked up if we are able to have some of that performance data that you were talking about, Paul. So thank you. Right. I don't see anybody else who wanted to speak, so apart from Chris, who apparently wants to speak.
Yeah, I just wanted to pick up the education issues there, particularly the school boundary issues. I'm not aware of any consultations we've done on school boundary issues, so if you could direct information.
It has taken place. I know that there's numerous children who wanted to attend various secondary schools were not able to do that because the boundary had changed. And one lady told me it actually went through the middle of her house, and she's had to do an awful lot of letters because of trying to get her children into the school she wanted. So if we don't know about it, what's going on, please can you look into this?
I certainly can. Do you know which schools it particularly relates to?
I'm not going to say publicly, but I'll come back to you.
Yeah, perfect. Thank you.
Chair, can I, every year we do a proper reconciliation of all the school places and we go publicly about that. And taking your other point about finances, I'm not just being negative. There's a proper process around the finances of the council, which I would like to explore further, because I think it's a reasonable challenge, and we will try and work out some way of doing that effectively moving forward without taking away the responsibility from the cabinet member for resources through to the cabinet and then the full council. So there is regular monitoring does take place, but I take the point that where that affects the quality of the services that we're providing, then that is a legitimate issue. So I'm not being non-transparent. I think we need to be transparent, but it's how we do that without treading on the other toes of other committees. So thank you very much, Chair.
Thank you, and of course we appreciate the sensitivity in giving us detail too, because we don't want to be able to identify any individual. So I wanted to ask a few questions myself, but I'm first of all going to start off with something very positive. So I was speaking in to various officers in a completely informal setting, and the subject of the work around families first came up, and I'm sure you'll be delighted to know that there was only positive things that were now being said about the work, and particularly for Eugene, about how those officers felt that things had changed significantly and they were feeling much more optimistic about the future. So I wanted to share that with you. I also wanted to ask a question about the Regional Care Cooperative, and obviously we don't know the reasons why the proposal was turned down, but I did want to ask, because I chair the scrutiny panel that looks at Adoption West's collective work, whether something that was more of that size and shape had been considered, because it has struck me previously that the offer for the Southwest region, which I think was going to stretch all the way to the Isles of Scilly and sort of in all sorts of other directions, you know, perhaps it was too big and unwieldy a beast, and I just wondered, you know, whether or not something that was smaller and more easier to work with had been considered. And I had a couple of other questions, but if you want to tackle those two things first.
Chair, are you asking these questions under my report?
Yes.
Right, okay. On the Families First side, can I just say, we've got Paul sat with us as well, and I think the impact of having an assistant director who's been supporting Jean has been really important, and she'll give you the direct answer, and thank you for giving us advance notice of those two questions. And the Adoption West and the regional approach, I think, has been a major issue in the Southwest around government saying, or the Southwest is an area, but it goes all the way from the Scilly Isles right the way up to Gloucester and across to Wiltshire. It's a large area, and we have sub-areas quite clearly around Bristol and Plymouth where you could in actual fact have a different approach. But I don't think necessarily that's always accepted by government, but I'll hand over to Jean to give you the specific replies. Hello, Paul.
So on the Families First issue, thank you for that feedback, and it's absolutely right that with a permanent assistant director in place, that's been incredibly important in driving forward the work that we've been undertaking. There is still work to be done, though. So, in order to progress towards our November timeline, there's still a great deal of discussion and sharing with our colleagues. So, we're not completely through it at this stage. So, but we do appreciate that feedback. Very helpful. In terms of regional care cooperatives, it was really interesting. So I was looking at the areas, the regions that have just received funding from the recent tender. And there are now 7 regional care cooperatives. The largest, recently agreed, East and West Midlands, is 24 local authorities joining. The North East is 12 authorities. And then there's the London group. It doesn't say how many local authorities, but led by Camden, and then Sefton is leading the Cheshire and Merseyside region. So each of those regions are very different sizes, but 24 local authorities is a very big group when we would be 14, 15 with ours of Scilly. We were ready for, you know, whatever happened in terms of outcome, and as a region we continue to work together, as I say, under the South West Children's Alliance. We're already grouped as local authorities to try to resolve some of the issues that we face in respect of placement sufficiency. I think, though, we're also considering some of those smaller clusters, as Councillor May has described, and that's about how we get on with some of this work while we wait for further opportunities to bid for funding. We now know that there's over 100 local authorities who are part of regional care cooperatives from the 7 authorities. 7 regional care cooperatives, apologies, and we are fully expecting to be asked to make arrangements sooner rather than later. Regional care cooperatives is part of the Children's Wellbeing and Schools Act that received royal assent in April, and regional cooperation is how it's framed in the legislation. So we will wait for that feedback. We're happy to share what that feedback tells us and to think about what the next steps are, because we'll be asking the Department for Education what are the next steps for us, because we're really keen to do this.
Thank you, Jean. And then my last question was really, it's more of a request, picking up on some of the points that Joanna's made as well, around maths and you know, various concerns that we still have around the delivery of education and, you know, their autonomy that's almost entirely now outside of this authority. And I think, if I'm right, so there's only, it's either 3 or 4 of our schools now that are within the council's own structure, which suggests that it would be timely to have another session with the regional schools director. So I think, Chris, you might need to put that on your list of things that we would like to happen sooner rather than later. Thank you.
We can certainly make that request. We meet, I meet, myself and Jean will meet with the DFE regularly once a term, met with them last week. I will meet them again in the beginning of September. They've been here before, they've been here twice now. I'm sure they'll happily come again and have a conversation. I'm sure I could also invite 1 or 2 trust CEOs as well. I'm sure they'd be happy to come along and take any questions that you have.
Thank you. Well, our next children-focused meeting is October, so perhaps that would fit well with your next meeting with the regional director and those other chief executives. Thank you. Paul.
Chair, can I also offer around Families First that when Jean has been through that proper process, there was a lot of discussion at the start of the process where things were difficult. And we had a special council meeting where we offered councillors to come along and talk, and Jean gave a briefing. When we're at the point where we're going to be making some decisions, I think we'll try and organise another event for all councillors so that you can actually see, because this is a major change in legislation And it is really, really important, I think, for us to be able to keep all councillors involved, because as you've highlighted again, we've got to develop new skills in the way that we actually engage with education moving forward. But there's also the lead person in terms of education in DFE, but they also have a lead person in terms of social care. So I think we could perhaps also get them along, because I think we're in a world where the public still expect us to be providing good education, but it's outside of our hands. But how we actually engage through the School Standards Board, Schools Forum, etc., it is important that we actually do influence the way that things develop over a period of time for the good of children and families in the area. So I think it's important that we actually recognise as a committee that we can't necessarily tell people what to do, the point that Lucy was making earlier on, but we can influence the way that people actually are providing those services effectively for us. And in terms of my own personal politics, you know that's not where I want to be, but we are there, and we've got to work the system that is there in the best way that we can moving forward. So thank you, Chair. Good questions.
Thank you very much, Paul. So I'm now going to move on to the next item, which is the Integrated Care Board's update. Thank you, Lucy, for sharing the report with us. And I think Joanna's definitely going to have some questions around dentistry, because we discussed dentistry at our last full council meeting, a motion that was brought to the council by Joanna. Lucy, was there anything else you wanted to add? And actually, I think you probably would like to take this opportunity to introduce yourself, because I don't think we've done that so far.
I was just thinking that, Chair. Hi, everyone. Good morning. I'm Lucy Baker. I'm the Place Director for Baines, for Bath, Swindon, Wiltshire, Somerset and Dorset ICB. Just a couple of points to pull out the report, if I may, and I am aware of the Green Party motion that has been shared with me. We have provided some more detailed information in the report around supervised toothbrushing scheme as requested, really naming where we are with each area. Appreciating this is a CYP session, but we have included an update on the IUH pharmacy prescription changes. That has been reviewed, and there is no evidence of impact with that change. So just wanted to draw members' attention to that item. And then in terms of the update on neighbourhoods, at our last neighbourhood workshop, which was held at Bath Racecourse, we really agreed the next stage of focus is around a dedicated children and young people's element. So within Baines, what we are trying to do is to line up the neighbourhood geographies that I've previously described at this scrutiny panel with the SEND school clustering geographies. So that's the work we're really focusing on, so we can be really clear about the offer in each of those communities. The only other point I wanted to raise, Chair, is just to note a typo. On the neighbourhood update, we have moved away from describing Summer Valley into describing 3 valleys, particularly to pay attention to the Chew Valley area. And the next stage of our work is to draw those more detailed boundaries, working with local communities to confirm which community sits in which neighbourhood footprint. Thank you.
Thank you, Lucy, and I'm sure David will be very pleased to know that Chew Valley has already had a mention. Joanna.
Thank you for your report, and thank you for last month's report and where you gave dental figures out. I would like to have a one-to-one with you on that, if we could arrange that, because there is a whole load of questions I have from last month's ICB report. As you're aware, the Green Group with the Liberal Democrats and a cross-party that has led from many years of being in this PDS, there was a full motion to council on dentistry and units of dental care and how better to deliver that. So we as a council unanimously passed that motion. We would certainly encourage the ICB to look at that motion and to register the issue widely. I can see that you've said in your rural dentistry service, which included evidence of a specific mobile dental unit needed in rural areas, also recognising mobile units are not a long-term provision and cannot replace high street access. My question to you on that would be, I know we've always asked for a dental bus of some kind, but it wasn't just to service rural areas. There are homeless people, there are people in urban areas that just can't get to a dentist and no longer can afford the offers of private dentistry and can't seem to get NHS dentists. So it was about the wider, how do you reach different communities and go there? So I guess that's what I've got to say. Thank you.
Lucy.
Thank you, Councillor Wright. Very happy to meet with you on a one-to-one to talk through the issues. We have shared some information that there have been some very recent national changes to dentistry commissioning and payments. We're just working through understanding what they mean, and we're very happy to share that detail with you. So let's get in touch and sort that out. I agree around dental access. There was a particular ask when we were looking at rural communities, which is where we've been looking at the dental bus, but it's looking at how that bus could be used to meet individuals who have other health inequalities is absolutely something we'll be exploring. So I'll be in touch to set up a session with you. Thank you.
Thank you, Lucy. I have Leslie, Kevin. No, it's not Leslie. Sorry, it's Liz. I apologise. So it's Liz first, and then Kevin, and then David.
I still get over being called Leslie, but that's fine, sorry. I'm going to jump straight to the neighbourhood health plan and community engagement. And firstly, I would like to say, and I think I've done a little bit of research amongst fellow councillors, I don't think we got an invite to the workshop. And I think it would be a really good one, especially as you've said what the focus is going to be. That's an important one for as many of us councillors to attend as possible. But my other kind of comment would be, do we need an ICB calendar to know what's happening in the future with proper opportunities for engagement if we need to be involved? And is there a BSW forward plan that we perhaps need to be aware of? But my question is, this neighbourhood health plan, we've talked about the geographical entities that will be involved, and it's starting to be planned at the moment. How will my residents know this neighbourhood plan is in place, and what difference is it going to make to residents in Baines?
Thank you for your questions. Just to confirm, we did invite some elected membership to the workshop at Bath Racecourse last week. They were unable to attend. As described in the paper, the workshop approach is a rollout approach, with the main workshop being workshop 3 that will be coming up, and I'm very happy to extend the invite list to that and get that out so people have got it in their calendars as soon as possible. In terms of your query about forward plan, we have previously brought to Scrutiny Committee our priorities as an ICB, so happy to bring that as a refresh and set it against a timeline. Very happy to provide an ICB calendar. As I've described before, we're just in the process of concluding our restructure. That's going to conclude at the end of August, and that will give us then more opportunity to be really clear on what the engagement opportunities are going to be moving forward. And from a neighbourhood perspective, we've previously shared the neighbourhood vision that I'm happy to recirculate, which I think really clearly sets out what the aims and objectives of the neighbourhood offer is. And what will feel different to residents is they will know where in their local neighbourhood they can go for support, that all provision across local authority delivered provision, health provision, VCSFE provision will wrap around them, but that will be in a neighbourhood offer. So the future is around, if you have some concerns in your neighbourhood, you can go, you might talk to your village agent, you might visit the neighbourhood health centre, but your issue will be picked up early with a focus on prevention. So there are a number of metrics that we'll be measuring, but how we want it to feel differently is people know where to go in their local neighbourhood to get support, and that support will be seamless and not based on organisational boundaries.
Very much.
Just picking picking up on that point about the invitation list, I think I'd be interested to know who was invited, and perhaps for future reference it might be useful to invite the elected members that sit on this panel in addition.
Happy to share that after this meeting. I think it would be really helpful to work through attendance and the best way to do that, but happy to have that conversation with you, Chair.
Thank you very much, Lucy. Right, turning back to my list, I have Kevin and then David and then Leslie.
Thank you, Chair. Just a couple of things. I think I may have misunderstood your reports on the dentistry update from my last question. Reading the paragraph, it looks like you're telling me that there was nothing left in the dentistry budget. What I was trying to marry up then was, you did say that several dentists hadn't used their budget and money had been clawed back. How had it been repurposed within that dentistry budget, probably was what I was trying to get at, and was it actually going back into trying to deal with the services that people are crying out for? Sorry, shall I go through the... okay, bless you. Just try and keep those together. So then the second bit around dentistry was that on page 27, you mentioned around 50% uptake. And I didn't know whether that was related to pupils or the schools taking part. And if so, what was the reason for not 100% uptake? And in that case, again, have the ICB considered health visitor support rather than schools, again, as a vehicle for doing brushing supervised and actually getting to those people? Because health visitors, hopefully children are brushing their teeth between the time they start school and the time they're born. I didn't understand what IMD was on your tables on page 28. It's a minor point there. You mentioned Health Watch. Can you say what the benefits of Health Watch might, because I know you say that there is engagement opportunities used locally anyway. That's fine. But are there key benefits the Health Watch provides that those other types of engagement don't? Could you also elucidate on the prescription delivery service what evidence was used as part of the impact, to measure the impact, what evidence you actually brought forward? And in the neighbourhood health plan, if you're saying that, again, I may have misunderstood this totally, but if you're saying to somebody that they can go and find help for their health anywhere in the neighbourhood, who actually is now coordinating an individual patient's needs and looking at them holistically in terms of what they've asked for and who actually is dealing with that? Because it sounds like that the old model of I go to my doctor when I have anything problem-wise and they direct me may not be on the cards. But if that's not on the cards, then who else knows me as an individual in this system? Because it seems that I could be going anywhere for health issues and somebody's actually saying, you've got an awful lot of need here and nobody's putting it together. And very finally, on page 31, you have a little table of funding, presumably to get the neighbourhood programme underway. And I couldn't see anything, unless I've misunderstood Soma Valley, for Chew Valley, because I take Soma Valley to be Mid-Southern or Rastock area, but you may not.
There's a lot of questions there. I will try and work through them one by one, and please shout if I've missed anything. So in terms of the dental budget, I think we've described in previous papers brought to this scrutiny that for any clawback, all of the clawback has gone back into dental recommissioning. So that clawback is not used in terms of offsetting any other financial lines. It's all gone back into invest in dentistry. We have provided a lot of information on that. I'm happy to have a conversation perhaps separately about what else you might need, because I think we've repeated that message a number of times. In terms of supervised brushing, I will have to take away the question whether it's school or pupils as 50%. One of the things we do here is that school don't have time to do it. Just a reminder to Scrutiny that public health nursing is commissioned by the local authority, and that team I know are aware from health visitors, what we used to call health visitors, they are working with families. So they are closely working together between schools and school-aged nursing services, which is what we now call school nurses. IMD is a population metric, so I'm very happy to send you an email to explain what that is. In terms of your Health Watch question, Health Watch, as you'll be aware, are a national organisation that have a number of statutory functions as part of the way they're commissioned. Some of that is really important work they do on engagement. I think what we're describing in the report is there was a national decision to cease Health Watch as a national organisation that's being driven nationally. From an ICB position, what we're trying to describe in the paper is that we are watching that position very closely to understand what the impact might be, but trying to offer some reassurance that from an ICB point of view, we also do a huge amount of engagement work and work with our partners on that engagement work. So within our new cluster, we will have a dedicated public engagement team who will look at how they draw all of that together. So it's us preparing for, if Health Watch doesn't exist in the future, then what are we doing about engagements? In terms of the IUH pharmacy, the evidence used was complaint themes and any concerns raised by members of the population that their needs are not being met with the change from pharmacy delivery to transferring those individuals to the national scheme. And there was no evidence that we had unmet need. In terms of the neighbourhood plan, I very briefly described earlier that there was a typo about Summer Valley. At the moment, we are including 3 valleys, and Chew does sit within 3 valleys in terms of the funding allocations. And then in terms of your question about neighbourhood needs, the future will be that not everybody will go to a GP. Not everyone needs to go to a GP. And what happens is people present to their GP, which means those individuals that do need GP support have to wait longer than we would wish. So the model we're envisaging is some of the building on the foundation of the work done by the Community Wellbeing Hub, where you might have a village agent who is the person who knows that individual or family the best, and they will support the coordination of those persons' needs. So that's the bit of co-design we're doing at Workshop 3, which is who are the right people to play that coordination function, which may not be a health professional. It's how they link into health professionals. And that's the whole vision around that neighbourhood offer.
Thank you, Lucy. I think that was really helpful. David, I'm sure you're going to pick up on the 3 valleys issue.
Thank you, Chair. Kevin kind of asked most of the questions. Yeah, I was going to pick up slightly on the 3 valleys issue. Certainly in the report where it said Summer Valley, I had to then Google and see that it was a euphemism also for the 3 valleys. So it would be handy if we could just stick to 3 valleys. It seems more inclusive. And I also want to thank you for your dentistry update, and I look forward to a little bit more detailed response as that work progresses. Thank you very much.
Thank you, David. Leslie?
Thank you for the report.
I didn't know if you wanted to respond at all. I wasn't sure there was anything you needed to respond to.
No, just as I said, that was a typo I didn't spot, and I'm being clear with everyone, it's 3 valleys.
Leslie?
Thank you for the report, Lucy. On the dentistry issue, is this a public health issue regarding looking at another aspect of this, like healthy eating, and where in the plans is that? The pharmacy issue at the IUH, this is another occasion when we've been told rather than been involved. We've had no scrutiny of that, so hopefully it is working well as you've suggested. It will be good to see a report come back at some future date to make sure that it is working well. And who provides this service? You've talked about national, but I'm not sure who nationally is actually providing the service. On the neighbourhoods workshop, well, I didn't get an invite, but maybe I missed it in the multitude of emails, so it would be good to have some advance notice of these events. And the other thing for me is around the removal of Health Watch. I've worked with Health Watch in the past, and they've produced some very good pieces of work, including scrutinising the equality delivery systems that hospitals put together. So apparently the responsibility is going to go to the Department of Health and Social Care to manage this in the future, which is interesting because we've had response on our call-in requests. One took 15 months to get a reply, but also the ICBs. So what are the plans around the change there and the involvement of the local community and the co-design, co-production in the future? Thank you.
Thank you, Councillor Mansell, for your questions. Again, I'll try and take them in turn. You're right to raise healthy eating. There is a whole programme of work around healthy eating across the whole pathway, including that really important prevention work through to complications of excess weight in children. So it may be helpful if I bring a separate report back to a future meeting just to describe that programme and the interdependencies with that and the dental issue. In terms of the pharmacy issue, as I alluded to at the start of the meeting, I think it's really important we hold that workshop so we can provide clarity on the role of scrutiny from a health perspective. Every day the NHS makes decisions around service delivery. Not all of them will come to scrutiny. I am very mindful that John Palmer, who is the Managing Director of the RUH, and myself have committed to bringing more information through to the scrutiny panel, and I think it would be helpful to gain a collaborative understanding of what we're bringing that requires scrutiny and what we're bringing around information and decisions. So I think that workshop would help us work through that. Councillor Mansell, I'll come back to you with the name of the National NHS Delivery Service. I can't remember it off the top of my head, but I'll come back and let you know who the provider of that is. Neighbourhood invite, I've committed to sending elected members the invite for the next workshop, and we'll get that out as soon as we can, noting the ask for advance notice. And just on Health Watch, as I've described, the changes to Health Watch are a national decision. We watch to see what happens with that national decision. We're aware that we are open to change at any time, particularly with potential political changes this week in terms of who may be leading the Department of Health and Social Care. As I also alluded to, as part of our ICB cluster, we have a dedicated public engagement team. I'm very happy to bring an update back just to assure members of the role of that team and how they will continue to work with partners in our communities on that public engagement piece.
Thank you, Lucy. Paul, did you want to add?
Can I just ask Lucy a couple of questions?
Are you on my panel? Yes, you can.
No, it's just on the dentistry issue, which was dealt with last week at the full council. It was about the general picture, and this is, if you like, more specific. So I gave a commitment at the full council that we would try and raise this at the Health and Wellbeing Board, and if there's changes coming through, I'll try and get that on the agenda for the next Health and Wellbeing Board so that we can actually talk about the general picture around dentistry. And I spoke to Lucy just before the meeting, but I think it's important for it was a unanimous decision, I think, by the council around the concerns around the access, the number, and that wasn't just about children's services, it was about adults and children's services. So I think that's really important. And talking about the Health and Wellbeing Board, the Health Watch come along to the Health and Wellbeing Board, and they're really positive in the way that they actually raise issues independently, and I think that's a great value. And the healthy eating, surely isn't that public health as well?
It is a joint piece of work, Councillor May, so I'll talk to Paul Scott and we'll bring something back together.
Thank you.
Thank you.
Chair, can I just come back on the Health Watch issue? So it's good to know that there's an engagement team working with the public. So can we have a report on that so we can see what's being said? And also it'd be good to be informed about the role for scrutiny in regards to the BSW, because I must admit I'm in the dark about it, and I don't feel that we've been getting many reports, if any reports, so I'm not sure what we can scrutinise if we don't get those reports. Thank you.
So, Leslie, just to hopefully clarify what I think Lucy was reminding us of, we were going to have a workshop that looks at, for this panel, that looks at our role in those health decisions. So that's something to be arranged. And also we are expecting RUH representation on this panel in future as well. So these are points that I will pick up amongst other items on my agenda around the call-in specifically at my meeting on Friday. Okay, Lucy, did you want to add anything?
Yeah, in terms of the ICB cluster public engagement team, they are just being recruited. So I'm very happy to bring back a report, but Chair, if I could do that in a couple of meetings' time, just to give that new team an opportunity to bed in. But there is very frequent engagement work happening. There was work being done around our neighbourhood offer with the boating community, for example, very recently. So I will work with them to see what we can produce and bring a fuller report back at another stage. And just to emphasise what I said earlier, I think it would be really helpful for us to work through that role of scrutiny in the workshop. I think that will help make sure that the correct things are coming to this scrutiny panel. But just to reconfirm, there are NHS decisions made every day. Not all of them will come to this panel. We need the clarity about managing expectations, I think.
Thank you, Lucy. And can I just add then to that piece of work where you're talking about the boater community and just picking up, I think, on a point that Joanna was referring to, or referencing, can we also include something about our homeless population as well, about their health and well-being? Because I know it's a matter of interest to members of this panel too. Kevin, I will bring you in one moment, but I just need to listen to what Kerry said. So we're just having a chat about the requirement to have a workshop. So Kevin, very quickly.
Yeah. Thank you, Chair. Just one thing, Lucy, on the RUS, the prescription delivery service. When the gentleman came from the pharmacy service to talk to us, I understood that there would be relatively few people involved in the particular change that he was talking about. I just wondered again, because of vulnerability and people saying things, and maybe, and I may have got your reply wrong, because it sounded like you were looking at complaints or anything analysed, and not everybody is forthright or wanting to say things. Whether that engagement that we suggested at that time when he came was done personally and people gave feedback to actually how they found what was replacing, what was there.
So within the report, it describes that that's exactly what happened. So there were a small number of patients who were still accessing this service. Those patients were worked with to help them transfer onto the national programme, but they were supported to do that. It wasn't just a, you now need to go and do that. And part of the process was those conversations allowed the IOH to understand were there any individuals who were concerned about that change. So for those individuals that had very particular needs that needed additional support, they were worked with, and it was a conversation which helps give us the assurance that we're not hearing through those conversations and general feedback that there are people in the community that this had a negative impact on, with people being supported into the new national delivery model, which is what the majority of people would use. This was a very historic practice that was changed to come in line with the new national way of prescribing medications.
Thank you. I'm not seeing any other questions from my panel, so I'll take the opportunity to just raise a couple of points myself. So, am I right in understanding that there's now a much more directed move away from almost individual doctors per person? And it makes me think again about my ongoing question around university students' access to health services, and is there still is there still any sort of rationale for a student having to be, choose between having a home doctor or a doctor where they are studying, bearing in mind they're often spending 50% of their time in either location. It seems to me, particularly with the advance in technology as well, that students could be dual registered if that, and that would fit with that direction of travel that you've described as well. And then I think you're right to keep a watching eye on what's happening with Health Watch. I was in an LGA meeting last week, and there's still this uncertainty as to whether or not Health Watch is going to be kept, whether or not it's going to be replaced with something that is truly independent, or whether or not it will be sort of put within the hospital and health service locally provision, which doesn't seem to give that independence that I think patients would want. So, yes, if you could answer any of those questions, that would be lovely.
Thank you, Chair. In terms of university students, sadly, you just can't be dual registered. So everyone's health access is deemed through the GP spine, and that is the GP that you're registered with at a point in time. What we are doing is, when we're looking at our neighbourhood cohorts, one of our priority cohorts in Baines is our university populations. That's the piece of work we'll be doing from workshop 3 and beyond, is to work with those students about how they would like to access services. A number of students have already said it's not about access to the GP, it's about access to other provision, particularly around elements of emotional wellbeing and mental health. So Councillor May will be aware one of the conversations we've agreed to have at the Health and Wellbeing Board is around student wellbeing, and that fits into this neighbourhood conversation. So as we have those conversations and we start forming with that engagement work what the university offer will be for at a neighbourhood level, very happy to continue those conversations with this panel.
Thank you, Lucy. I think that would be helpful, and I hope that the Student Community Partnership are going to be included in that meeting of the Health and Wellbeing Board. Because at the moment, from what I understand, if you are a student and you need to access health services, you have to go through the emergency route instead of, which I assume is a lot more expensive to be provided.
All students are encouraged to register with their local GP when they start their courses, but as I've described, we're working with the student population to understand the best way of them accessing services.
Thank you, Lucy. Right, I'm now going to close that item, and thank you, Lucy. I'm not sure you'll be staying to the end of the meeting, but thank you very much for your commitment to our panel. I'm now going to move on to the Youth Justice Plan, and before I start this, in fact, I probably should ask Paul May to introduce the item, or at least pick up any points that are not covered by the report. But I think you should be aware that in our pre-meeting, I think a number of concerns were raised about the challenges of this report, particularly in how it's presented. I understand there's going to be a change in ownership of the plan going forward, which I think, if you'd like to also speak a bit about that, I think would be really helpful. And I think many of the comments that we might make on this item will be suggested in the spirit of improving the reporting of this plan to us in the future. Both looking very puzzled. Perhaps I've misunderstood something. Jean?
Can I say something about this youth justice plan? This is a nationally prescribed template that we have to produce the plan on. So the National Youth Justice Board sets that template for us. So this is a plan that has to be published, and so it's a requirement of us. And I'm really conscious that it includes a good deal of data that has got very much a youth justice language to it, but it is a requirement, a national requirement of us. So I wanted to put it in that context, in the sense that it's not in our gift to change that report unless there is a change nationally to the template that we're required to complete.
Okay, I may then have been misinformed or misunderstood what I was being told. Paul, did you want to come in? But thank you, Jean, that's really helpful.
No, I'm a bit confused. I don't, the specifics of what you're saying, I just don't understand at the moment. The report of this is, we've seen it for year after year after year, and the team actually work exceedingly well with young people, and the success of youth justice moving towards the child as opposed to offenders, I think has been a major move that we've promoted here through this committee for the last 2 or 3 years. So I'm a bit surprised at what the queries are, but let's deal with the queries as the report is presented, because it does have to go through to full council by statute, and there's a lot of partners engaged, but the lead partner is the council. And it identifies, if you like, the most vulnerable areas in terms of equalities, which is SEND children and ethnic minority children as well. And the plan is I thought was very, very good. So I'm a bit surprised at, if there's concerns, but it's going to be presented by Paul this morning. Do you want to bring out the specifics before we start, or after we've presented the report?
So we've all, I think, spent many hours reading this report, and I think that's part of the issue. Perhaps if there's anything to add, Paul could add whatever needs to be added, but would you rather hear the concerns and the questions, Paul? But I will allow you to introduce yourself briefly. Thank you.
Good morning, everybody. I'm Paul Chalcross, Assistant Director for Children and Young People Services. Fairly new in post. This is my second committee, so getting to know a few of you already. I had planned to give a brief overview of the report. If you've all read it in detail, that may not be necessary, but happy to do whatever the committee feels is going to serve your interests best.
I think perhaps we will park the overview, but you could obviously draw on that, I guess, when responding to the various comments and questions that the panel has. Okay, so panel, who would like to start? Kevin, and then Liz, and then Dave.
Thank you, Paul. I suppose, yes, from my point of view, it was a lot of good background reading in it, and I understand probably as a template why certain things are covered. It would have been very useful, which may be what you would have done a second ago, which is just maybe an executive summary, key highlights for last year, areas of strength, weakness, progress, current plan for next year, and then obviously all those bits here on those pages would be useful background that we could then delve into. So sadly, I sort of thought I got the hang of it in several parts, and then thought, no, I've missed it now because it's gone on to this and this and this. So my questions are very general level rather than particular things, I suppose. The first question was around, it looks like, from what I've read here, that, and again, we know we're talking about small numbers of people, but Baines in general has a good performance against national and the Southwest indicators. And again, have you identified either as an individual authority or as a group of Southwest, maybe, or other things, the good things that are happening that achieve that, and how to build on those things that are obviously achieving some good results here. The second thing was around the balance of prevention stroke reaction and the money that goes into either or both of those things. I wasn't quite sure where the Youth Justice Service fits in with prevention work. It's mentioned around the Baines risk outside the home strategy and various factors that the young people have identified. And so I was just wondering how, in terms of the Youth Justice Service, how much leeway it has on spending on prevention and what sort of prevention it can spend on. And then there was a last couple of things. One around looked after children. I couldn't see, maybe I got lost in the, as I was going through various sections, about how looked after children are part of this service. I know that because of the corporate parent issue, it was something that may have been brought out separately last year, but was looked into in the sense that are they involved in this, and if they are, what's being done separately to support them and to prevent them coming into the service. And I suppose two of the final quick things. One is around Connecting Families team was mentioned, and my understanding from past meetings was that this might be a team that is affected by structuring or changes around the first Families First project, and just wondered how that was impacting on this and whether that was staying as it is or its role in this is staying as it is but is slightly changing. I'm just trying to find the last one I had. And the last one was maybe a little direct question, or two little direct questions. One on page 71 around enhanced case management project, which ended in March 26. What were the key benefits of that project, and will you be able to maintain those benefits in another way? And what do you feel about your staffing structure and the ethnic mix of staff on page 94?
Lots of questions, thank you. I will preface my responses by saying that I am currently acting into that role of head of service. We have a vacancy in that space at the moment, which we will be completing as part of our overall restructure. There are likely to be some changes in terms of areas of responsibility, so we haven't recruited to that post permanently. I am really pleased that we have literally today managed to secure an interim into that role who will provide some cover until we do have a permanent person in place. I'm prefacing that to say I don't necessarily have the level of detail of some of the questions that my colleagues who would have been presenting here previously would have, so forgive me for that. We can certainly go away and find information that I don't have. In terms of an executive summary, I think that's a reasonable request. It's a long report. I think I can see how that would be helpful. Your question around the good work, how is it working and why in terms of partnership? I think that's really difficult to answer. I think the Youth Justice Service is essentially a really good kind of example of how partnership working across a number of different services can and should improve outcomes for children. It's a truly multidisciplinary team. It's made up of social workers, police officers, health colleagues, education have a significant input into those teams. So I think that they were set up specifically for that reason. So in some senses, we learn from the good work that they do, and we're incorporating that into the way that we create structures elsewhere in our services. So I think that's really, really important in terms of performance. You will have seen potentially that, you may or may not have seen, but in 2025 in February, an inspection report was published around the service. I'm sure that would have come to a previous committee. So that sets out in a little bit more detail the kind of qualities of work and what's behind some of the achievements and outcomes that the service have had. I think thinking about that balance of prevention work and court work is a really, really good question. So we have two particular services within the Youth Justice team that support prevention work. So one of them is the turnaround service, and the other is our Compass service, which provides preventative work specifically for children aged 8 to 17. I think there is never a kind of particularly clear line between prevention and support for children in that space. I think in terms of pre-court activity, we are trying to prevent children from escalating into criminal justice, and some of those disposals are about very much doing that, preventing escalation into further offending. I think it's also important to recognise, and this kind of touches on another of your questions, that the work that goes on in the team doesn't take place in isolation from children who are supported by other agencies as well, including the local authority, including children's social care. So children may be subject to support and intervention from the Youth Justice Service. They may also be subject to a child in need plan or a child protection plan. As you alluded to, they sometimes will be children in our care. And a proportion of those children that we're working with, 12%, are children who are working with us already. So those teams work really closely together. We sit in the same office, which is a real benefit and quite unusual in terms of my experience. So our youth justice colleagues sit next to our social work colleagues, to our adolescent child exploitation team colleagues, and I hear those conversations going on every day. I hear about the good practice that occurs as a result of that co-location. It's really a system-wide approach to supporting children, bringing together those who are best placed to carry out particular pieces of work, clearly locating the expertise in the practitioners that have the most experience to support children in the best possible way. Connecting Families team you talked about. It's a really good question. Our Connecting Families team, we're really proud and pleased of the work that they do and how they do that. The new Families First partnership reforms specifically ask us to change the way we think about providing targeted early help in the local authority. So our current plans in Baines, and we're consulting on those as we speak, are around bringing those skilled practitioners who are differently qualified, who aren't necessarily social work qualified, into what we will call family help teams. So we want to utilize that expertise and kind of build on that to remove those artificial kind of boundaries that we have seen in the past, where children move from, for example, Connecting Families to a child in need or a child protection plan. So those workers will remain within the local authority, within our family help teams, and they will expand upon the kind of range and quality of the work that they do. In terms of the Enhanced Case Management Project, unless Jean is able to help, that's something I'll need to come back to you on. I'm afraid I'm not aware of the details of that particular piece of work, but we can certainly come back on that. Any short-term activity that takes place that's grant-funded, whenever we undertake that kind of work, we will be absolutely looking at how we can mainstream that into future practice. And then in terms of staff structure, what was your specific question about that? If you could repeat that, that'd be really helpful.
Yeah, sorry. It was really, did you have any comment to make on the staffing structure that you outlined on page 94 in terms of ethnic mix and anything else that you may want to comment on?
I think in terms of staffing in the Youth Justice Service and in any part of our organisation, we would like and would want, wherever possible, our staff to reflect the makeup of the population whom they are supporting. But alongside that, of course, when we advertise and interview for roles, we also look for the best people who are best qualified to do any particular role. In Baines, I think our population of black and minority ethnic children is around just over 9%. And we know that unfortunately black and minority ethnic children are overrepresented in the population that the Youth Justice Service and indeed our wider services work with, and that is an area of improvement that you will have seen within the rest of the document. So I think our focus in terms of recruitment is we want the best people, and we want to try and reflect the community that they're supporting wherever that's possible.
Thank you, Paul. Jean.
Could I just add to a couple of those things? So the Ministry of Justice's white paper that was published in May this year focuses on earliest intervention and prevention, but also really thinking much more proactively about the length of orders should a child need to be on a youth justice order. The approach that we've taken in Baines over a number of years has been very much early intervention. It's why our first-time entrance into the youth justice system and indeed our reoffending rates are as low as they are. They are really something to be proud of nationally. So we do an awful lot of work, and Paul talks about Compass. Compass is our own response in terms of preventative work. Turnaround is grant funded. The white paper that I've just referenced, Cutting Youth Crime, Changing Young Lives, advocates a 15 million, circa 15 million national fund that will continue for the next 3 years to support that preventative work. So we will benefit from that in Baines. And the overall numbers that we're talking about, it's less than 40 children that we're talking about in Bath and North East Somerset. It's 33 currently. That number always fluctuates. That's why I say circa 40 children. At any one time, we've usually got no children in custody. At the moment, we have one. It's very, very good evidence in terms of how we support children and young people. And in terms of that crossover with other social care teams, while 60% of that population, you'd have seen this in the report, and I appreciate that the plan is detailed and long, 60% have some form of SEN or SEND need, and 50% are either children on child protection plans, child in need plans, or indeed looked after by us. But it will be 12, 16 and 16% respectively in terms of those groups. So we're talking about small numbers of children who we offer really intensive support to, both in terms of prevention, but also should they come into the youth justice system, about supporting them not to re-offend again. So it's a service we're really proud of. So we do want to be able to make it plainer so that it's really understandable going forward.
Kevin, yes.
Sorry, just on the looked after children part that you mentioned there, could you actually, if it's not part of the template, could you actually sort of expand that a bit for us anyway each time? Because the number of looked after children, is this rising, falling, and what good things are happening around that, please?
Very happy to do that. It's it doesn't fluctuate hugely, but I absolutely accept that we need to show you that evidence, and we can do that. Whether you want that following this committee to share some further information about trends over time in terms of children who are open to social care and other services, happy to do that.
Thank you, Jean. And I'm just using the Chair's prerogative to butt in. I assume then that the fund that you spoke of is in addition to monies that would be associated with the Family Firsts programme, but there would be an expectation that the interventions that come through for Families First would have a marked impact on those then coming into the youth justice system. So one would assume that in a year or two's time, the numbers would be starting to fall from that rather steady sort of 30 to 40, you know, and coming back down. So would that then mean that the money that we as a council put into youth justice, we should expect that commitment to be reduced as well?
So most of the funding for the Youth Justice Service is grant funding from central government through the Ministry of Justice. The turnaround grant will also come through the Ministry of Justice, as the current grant for turnaround already does. So it would be a continuation of turnaround funding. The funding for our Youth Justice Service is heavily ring-fenced. There are only certain things that we can spend it on, and we cannot spend it on other issues. So there isn't the automatic crossover to Families First, because this is for children and young people who come to the notice of the police in some form or other through activity that is deemed to be either at risk of criminal activity or indeed is criminal activity. But we make decisions about diversion, So out-of-court settlements, thinking about how we support young people to be diverted from the criminal justice system. So it's very particular in terms of how we are required to use that grant. But in general terms, because some of the children that we're talking about find themselves on child in need plans or child protection plans or in our care, that will most often be as a consequence of issues happening in their family system. Sometimes it's about things that are happening outside of the home, but mostly it will be a combination of those things. So there will be an impact, but as I say, most of the funding for youth justice is grant funded or is contributions from our partner agencies in order to support the work we do.
So are you saying that you wouldn't expect the money that is used in the youth justice system then to be reduced because it's not so seamless that, you know, prevention work is different to preventing children coming into the youth justice system?
So our youth justice grant is reviewed each year, and the amount we are on the basis of the number of children we support, and so our data that goes to the Ministry of Justice dictates the budget that we get, the grant that we get from them year on year. So it is reviewed on an annual basis for us anyway by the Ministry of Justice.
Thank you. So back to my list. I think, David, you were next on my list.
Thank you, Chair. Thank you for your report. There's lots of good stuff in there. Can you just remind me, what's the substantive outcome?
So this is where you get into the really particularistics of the youth justice system. So this is thinking about an outcome that has been formally evidenced and finalised within the criminal justice legislation. So we'd have to do a briefing on that, and I would need one of my youth justice team here to be able to do any more justice to that than I can right at this moment.
Okay, thanks. Second question is page 16 of your report. You report a 44% reduction in first-time entrants with substantive outcomes. So that would appear to show that the preventions across the patch, the interventions are working. Can you just reassure me that this isn't about change of definition, change of reporting, change of policing?
Those definitions have been the same for some considerable time. So it's not as a consequence of changes, it is as a consequence of partnership practice. So, you know, the development of child-centred policing, for example, has been incredibly powerful in how agencies work together to think about alternatives to children receiving a caution, for example. So that would be one substantive outcome. So as opposed to a caution, a young person would be offered the opportunity of engaging with our turnaround workers, for example, in order to engage in really pro-social, positive activities that really divert them from any further criminal activity. So it's a combination of factors that have led to that decrease. And again, we're talking about small numbers. They can fluctuate, but it's certainly not about changing definitions, changing practice, I would say.
Thank you, that's great.
Okay, so on my list now I've got Liz, Leslie and then Paul.
Thank you, Chair. Many of the things I was going to say have already been said, but I would like to reiterate again that the Youth Justice Plan is working in the sense that the numbers of offending, re-offending and the numbers of young people in custody have not increased, and so therefore it is actually working. Obviously, I think many other councillors will ask questions about the disproportionality, and we see it every year, the fact that the numbers of SEND and young people from minority groups are overrepresented. And I was interested to find out, one of my questions was, how many young people are we actually talking about? And we're talking about 40, which, you know, are very low numbers, and it's good to see that our numbers are very low. However, I want to talk firstly about cuts and about finance, and I looked at page 61 of the budget cuts and contributions. We're still paying more than anybody else, even with the grant. We're still paying an awful lot of money, and it looks like the police are not having an awful lot to put into the budget, but are obviously reading through the report, which, can I just say, took a lot of reading, but obviously an awful lot of work was put into it. Shows that, you know, they're very involved, but they don't put in that amount of money. Now, that's just a comment. But what I do want to say is I noticed that the national pool budget will be overspent if contributions are not increased. So that's quite worrying. And it said also that if the budget is cut directly or indirectly, what are the most urgent pressure areas? I don't know whether anyone can answer this because it was Carla Cooper who wrote the report. So what are we looking at as councillors? Are we looking at any areas that we cover at the moment that might have to be cut or reduced? And what are the most urgent pressure areas? So I'll stop there, and with the Chair's permission, I've got a couple more questions.
I think if the detail of the report does talk about this as a risk in terms of partner contributions, you'll have seen that. It's raising that as something which we need to be really aware of and take some action at this point. We are not in the position where we are looking to make any cuts to the service at this point. Year on year, efficiencies have been made to allow for the effective reduction in partner contributions through inflation. And the team worked really hard to manage their resources, and they come in on budget or under budget, as I understand it, and have done for a number of years. I think Carla, in her final report for Baines, was highlighting that this situation needs attention pretty urgently. Otherwise, we will get to a point where we have to consider what that looks like. So we'll need to start having conversations when we have new managers and leaders in post with partners around that, alongside the other conversations that we're having around partner contributions to family help services, to multi-agency child protection teams, to the integrated front door. So there are huge pressures across the whole system. We work really well as a partnership. I will be hopeful that we can reach a point where we are continuing to provide the right level of services. At this point, we're not identifying any services that we need to cut.
Thank you. And I think that brings into what Councillor Wright was saying earlier about budget and being aware of budget considerations. The other question I'd like to add refers to the disproportionality, which I mentioned before. And I looked at the figures for Compass, which is what we run. And, you know, given the numbers, that 87% of young people who are accessing Compass are white. And I just wondered, you know, why aren't there more, I mean, many of those obviously will have special educational needs, but why are there not more mixed ethnic minority groups involved?
I think disproportionality is a really complex matter, isn't it? It's not a case of cause and effect. It's a case of a significant amount of societal and individual factors, family factors, which lead to the kind of family circumstances that Jean alluded to earlier in terms of how we support and provide help to different families. In terms of preventative early help work, that is largely voluntary. So the engagement that we have with families does depend on them wanting to support the work with their child. We recognise that disproportionality continues in the work that Compass is doing, as you've described. So the plan, I think, refers to a number of stages of how we manage that in terms of ethnicity. Part of that is recognition of the challenge, of the importance of the data, having practitioners who understand the causes of disproportionality, the reasons that young people in particular groups may be overrepresented, thinking about how we reach out into the community and work differently with certain groups, and then thinking about our individual work with each child and young person, irrespective of how they present ethnicity-wise or send-wise. So I think in that particular space, it is about how we potentially continue to think about how we reach out to support communities. Our approach in the Youth Justice Service is the same as the approach in our children's social care services around relational practice. So where young people are less interested or willing in working with us, our approach is to try and build relationships with them, with their parents, and see that as the foundation for positive change. And I guess that differs slightly from those children who come into the system as a result of the more substantive outcomes that we've referred to here, where they will be compelled and mandated to work with support staff. So I think there's probably a little bit of both in terms of that. Essentially, it's an ongoing piece of work. We have to do better in that space. I think we are absolutely in the space where we would confidently say that the team fully understand the challenges of disproportionality and are 100% committed to reaching out to those vulnerable groups.
I know it's a very complex area, and obviously there are no easy solutions. However, I have noticed that an education officer has been created, and that's a new thing, who's working with young people who are in school or in alternative provision. And we've always known that if you're permanently excluded from school, the opportunities for getting into trouble are very much increased. And so this education officer, according to the report, is working with children and young people who are permanently excluded or have had multiple suspensions. And all these are very good things, but how are these young people identified? I mean, are they identified as young people who've started to commit low-level crime and are known to the police? I just wondered, how is this happening? Because that is one of the avenues our young people will, if you like, start to offend. And I just wondered, how are these people identified?
I think I'll let Chris come in a moment in terms of that particular post, which I understand may have been around for some time. The work that the Youth Justice Service do is, as Jean said, very prescribed. So work comes in through our colleagues in the police, the CPS, children who are involved in crime, at risk of becoming involved in crime, at risk of exploitation and committing crime as a result of that. So that is the cohort that comes into that Youth Justice Service. That's very clearly prescribed. Alongside that, there are a number of other children, significant numbers, who we will work with as a result of their vulnerabilities within social care services, within what will be family health services, who will receive support from a number of different areas. So the Youth Justice Service is effectively a subset of our a larger cohort of vulnerable children within the local authority. But in terms of the work that you're talking about, that comes in via the usual routes that any child would be kind of supported within the youth justice system. So somebody who has committed a crime, who has been charged with a crime, or is at risk of getting involved in the criminal justice service and has a diversionary outcome as a result of that. Chris, I don't know if you want to add anything in terms of that specific role.
Yeah, just to see, it's a post that's been in the youth justice team for some time now, quite some time, and that's the education worker and the employment worker is recognition that education is a real protective factor for children and young people. Being outside of education is a risk factor, and being in education, training and employment after school as well is a piece of work that the youth justice team is really keen that it provides that support for as part of that wider holistic plan from when they're known to the youth justice team. The new education worker is I suppose that's been referenced because the previous post had been there for some time, so a new person has recently been recruited. My teams link really closely with that education worker, so Sarah Gunner from the virtual school will provide some one-to-one support to that person so that they're able to exercise their role quite clearly. And it's a really important post because we know that education is that real protective factor. In terms of how those preventative cases get known to the services, so those that come into contact for diversionary activity, which is recognised in the report, are children who have already come to the attention of the police, so there may have been something that they've already been spoken to or they've been potentially arrested for, which can be dealt with not through a substantive outcome but through a diversionary piece of work. So those young people are identified through that way. For Compass, those children and young people might be identified by a range of people. So it might be the police, but they've not actually come into formal contact with them, but they know of them through PCSOs or outreach work. Schools do a lot of referring of children and young people into Compass as well as do social care and other people who might know those siblings and young people. I think the numbers around children with black and ethnic minority young people which are known to Compass is probably we would like to identify more children who've been coming to that voluntary support. I think those who are known through diversionary activity, I think it's roughly 20% who are from a black and ethnic minority background. For those who are coming to Compass, it was 13%. So we are identifying more young people in Compass, but there's a little bit more work to get the right children and young people. Sarah Gunner and that education worker do a lot of work to promote those to promote Compass inclusion panels. So we have an inclusion panel for every primary, secondary area in Baines, and we do a lot of work through that to promote that. But there's always more work to do to make sure that that's a well-known and well-used service. What I would say is Compass is quite an effective service. It is council funded, not YJB funded. And has been for quite some time, and that's on the basis of actually when children and young people do go into the Compass service, they are their outcomes generally very positive in terms of whether they go on to re-offend or offend in the first place.
Thank you. So we've got Leslie, Paul and then Joanna. Leslie.
Yes, thank you for the report and for all the work that goes into delivering this. I'm not going to repeat what Kevin said, but I'm sure that Mark will have highlighted it in the minutes, the whole issue of looking at the outcomes and the achievements so we can scrutinise them. Because this is a good report. It's lots of information and it's lots of telling us what the plans are, but I get not a lot of sense as what's changed. You know, I used to work in drugs and alcohol years ago, under Doug Cameron, who had a completely different approach to working with people. And we used to see young people coming out of and not children, coming out of the bail hostels. And the majority of those had actually been sexually abused. And I'll go back to what I was saying earlier on, you know, we need to be picking this up. We need to be working with that. That's the early intervention work that needs to be done. What I would like to ask a question about is how does the equality impact assessment ensure that the youth justice plan will reduce existing inequalities rather than simply describe them? And I will draw your attention to one or two of the things in the equality impact assessment. If you look at gender reassignment, it does say there's a negative, it doesn't say there's a negative impact, but that's what it's describing. In that there isn't the depth of experience working with transgender children, but staff can access consultation from CAMS and SARI. I'm sure that's very good, but what about off the record who work with children? And what about the Diversity Trust, who I understand already works with this council, provides that sort of training, and it's very good as well. In relation to sexual orientation, now the questions are going to be asked apparently. Some children may not know. Similarly with gender identity, people may not know. However, again, it's a referral to off the record. And this then brings up the issue of funding. So we saw the voluntary sector having their funding cut during the last budget round. Jean, I've heard you talking about money being available nationally. So hopefully some of that will go to organisations like Off the Record, who do excellent work. Youth Connect as well in Radstock. They work with young people that have been excluded from schools, and they're getting some good results, but they're doing it on a shoestring. And if you look again at the Equality Impact Assessment, it says rural communities. Many of the children the Youth Justice Service works with live in rural communities. Well, is that more than who are in the city, or is it less than? Because I'm not sure what many means. And again, it says, well, what we'll do is we'll make sure that referral order panel meetings are held in the rural communities. I'm sure that'll have a massive impact. So what are the other actions that can be done around this? I think the Equality Impact Assessment is very high level in terms of its description, but I think it could probably do a little bit more work with it, the action plans coming forward. Thank you.
I'll pick up a couple of those points, and Jean may want to step in as well. I think in terms of the Equality Impact Assessment, I think by nature they are often quite high level. I think what we can also see in reality is that youth justice is an area where disproportionality, in this case linked to SEND needs and ethnicity, are addressed in a more comprehensive way than we will see in a number of different areas of work across the support that we give to children. I think in terms of specific support within the plan and how we're going to reduce and address disproportionality, I think just to pick up on some of the comments that were made earlier, we need to use data and audit and lived experience and feedback from children and families to identify the groups that we're wanting to support. We need to strengthen the access to services and improve prevention, reach and earlier support for children with SEND, and we've talked about the ways in which that can and will happen. I think there's something very much about building the confidence of staff as well in developing anti-racist practice and confidence in calling out what they see and working with that. And then I think in terms of the governance of the organisation, how we are held to account in various different ways, including by the local Youth Justice Board that Jean chairs, is important in terms of holding ourselves to account in that space. You'll have also read in the report about the child first approach. So, we are wanting, and we see in the vast majority of cases, that workers see children as children and not as criminals or as kind of data, individual pieces of data. The child first approach is really well embedded in youth justice services in Baines, and we would always want to do more in that space. But if you see a child for who they are, you see their family needs, you see their experience of trauma, you see their ethnicity, you see their sexuality, and everything that makes them into the individual that they are. So I think there's a lot of work going on in that space which really addresses some of the issues that have been raised there. Apologies, was there another particular area that you'd mentioned?
For me, it's about the training and where it's coming from and funding for the third sector, because we saw that being cut during the last budget round, and ensuring that the Equality Impact Assessment is robust in terms of its action plans.
I hear those challenges, and we will take those away for development. We have a Youth Justice Board this month, in fact, so these are issues that we can feed back in terms of issues arising for the service to consider. I think we need to think about how we've completed that Equalities Impact assessment, and actually go back and look at what is available for staff and for young people in relation to those wider diversity issues that you raise. So I'd want us to go and look at that in some more detail before thinking about whether there's anything more we need to do, either ourselves or indeed with any other organisation. Can I say something also about the rurality issue? I think that given that we are always working with a small number of young people, they do receive bespoke packages of support wrapped around them wherever they are across the local authority. They are well supported, often by more than one professional, and where they need a particular intervention or service, they are really supported to access that wherever that happens across the local authority. In terms of the actual breakdown of numbers, again, I'd have to come back to you with that. It's not information I've got available at this committee, but we can certainly share the breakdown of where our young people are without, given the small number, disclosing anything in terms of child level details. So we'll look at how we could share something that shows the spread across our authority.
Thank you for that, Jean. And could I just ask as an additional, what diversionary actions are being carried out outside of the city? Last year, Radstock Town Council spent £35,000 on replacing equipment that had been damaged, set on fire and goodness knows what else, by young people. So what other actions are going on out in the rural areas to try and combat this? Thank you.
So it would be really helpful to understand what those issues and incidents are in order that I can provide something that is more than a general response to that. So if there are particular incidents, it would be really helpful to know about those so that we can provide direct and concrete information.
Thank you, Jean. I'm sure Leslie will follow that up with you. Right, so I've got Paul and then Joanna.
Thank you very much. I'd like to follow up on Liz's questions on overrepresentation and disproportionality. If we look at the charts on page 41, can you explain what's going on in the latest year and why we've suddenly got a dramatic increase in the traveller section? Thank you.
I wouldn't be able to talk in any detail about the individuals in that particular case. I'm not aware of any particular themes that are linked to traveller Gypsy Roma communities that are impacting on the service. What I would say is that the numbers are so small that you often need only 2 or 3 children to kind of skew figures quite significantly. But in terms of that particular group, I've not been made aware of any particular issues which would impact on their overrepresentation in that particular year. But I'm happy to have a look at that and come back.
If the numbers are so small, let's say in that last graph it's 111, can we have those figures added so that we can see the scale of the problem as opposed to a representation of the proportionality? So if they're really small, let's have those numbers and we can see how the numbers are declining and changing over time.
We can certainly consider that. I think what we have to try and avoid, as you know, in numbers that are so small, that we get into a point where we potentially present information which might allow young people to be identified. But that's something I can certainly take back to the team and see whether or not that's an option.
Paul, sorry, can you put your microphone on when you're speaking?
Sorry. If we've got very small numbers, putting those numbers out doesn't identify the individuals. Let's say it's 6, that's 222 in that last graph. That doesn't identify anyone. but it gives us a scale of the problem because it looks as though there's a real problem. So if you say it's very small numbers and it's just 6 children in total, let's have those so we can see how the numbers are changing over time, the total numbers are changing over time. And I don't see how giving us the total numbers identifies individuals.
As I say, I can certainly take back to the team that query in terms of how we present the data, but also in terms of whether there are any specific issues. I think we can see from the last 4 years that there's quite a lot of volatility in those numbers, and that's often the case where we have very small numbers of children who skew the figures.
I think Paul's general point, though, is well made, because when we're dealing with very small numbers, you know, it can feel a surprise, can't it, then? So one person it's 33% of the overall total. Okay, thank you, Paul, and thank you, Paul. Sorry, Paul, should I have asked you if you wanted to input into the pool bit? The pool. No, that's a joke. Joanna.
Thank you, Dina. Some people don't understand your jokes. The report asked the panel to note and comment on plans for delivery of the Youth Justice Service. So I would concur with Kevin that having an executive summary of what those plans are for the year ahead and what you're doing and what you want us to comment on how that is going would be really useful going forward, because it's great to have you on board, but a lot of us have been in this room a long time, and every year we sort of go around the same conversation. Last time I was not I left early the last PDS because I attended at Bath Abbey for Windrush Day some talks, and there were very powerful talks, including by Professor Sean Sobers, who teaches at the University of the West of England, who's an anthropologist there, about his childhood in Bath. And the line that his mother gave to him is, do not bring the police to this front door. And that was also the piece of work that he spoke about and how important that is. So I do think that there are a huge range of people in our local community that would have a lot of advice about how we make people in our community who are not white feel valued and wanted in this society. We are a room of white people, and we should acknowledge that first before we even proceed with this conversation, and that we need to bring better voices into this room to discuss this. I would clearly ask you to look at the list of people who spoke at Bath Abbey, because they gave very powerful speeches about what it feels like to grow up in white areas and how they disproportionately were treated, including the incredible work of 2 women who made sure that race and equality was recognized because their own children were discriminated at school and were put down for no other reason than the color of their skin. So this is a huge piece of work, and this city and Baines as a wider area has had a lot of work from that group of people who recognise those issues, as does Fairfield House. So, you know, why are we not turning to those areas and working with those groups of people? Because they exist here already and are expertly qualified to give those voices. Can we bring them into this room in some way? And I would also ask that about social housing providers. I know that we have lots of issues locally, and it appears that those social housing providers don't seem to be on your list and quite clearly part of that issue. So those are my comments to this. Thank you.
Just quickly, thank you for your comments. They're really helpful, and absolutely accept and agree with your analysis of the situation and what it's like to grow up in a largely white population. It's you know, it's, I guess, outside of Bristol in the southwest, this is a challenge which we all kind of see on a day-to-day basis, and I certainly feel that a kind of professional and a personal level every day. Having children grow up, my children grow up in a kind of largely white area is a real challenge. I think, having grown up myself in in areas which are slightly more diverse. So I think that's a really helpful prompt from you. Just in terms of the plans, at a very high level, our strategic priorities for the next year are, the first one is to reduce disproportionality. That's, again, thinking about how we work equitably, how we use data, how we promote anti-racist practice, to enhance our work with victims as well, which we haven't talked about much today. The support that we provide to victims is a growing area of practice in youth justice and is very much focused on in the new inspection framework. And I think we need to do some more work in that space. We do some really good work already, but I think the team will acknowledge that's an area where they would like more support. We're going to continue to embed the child first principles, so that kind of developmentally informed, strengths-based approach which sees children in the youth justice system as children, not as offenders. And then, of course, thinking about how we reduce serious violence, thinking about knife possession, working with the Violence Reduction Partnership, exploitation, working alongside our adolescent child exploitation team. So they're the kind of 4 priority areas. I think underneath that always sits that we have to continue to push that awareness that Chris referred to, which is that education is a protective factor. So making sure that every child that we work with has the best possible education, is supported to understand what their needs are educationally, because we know a high proportion will have special educational needs and or disabilities in this cohort.
Thank you, Paul, and thank you, Joanna, for those questions. My last person on this list is Michael.
Yes, just following up on Councillor Wright's comments just then. I don't know, you're probably already working closely with the Black Families Education Group. Is another, they're partly linked with Fairfield House, but they work with young people. They run a Saturday school for minority teenagers that feel disconnected from school. So, and they're definitely worth engaging with. And also, I guess, talking to the mosque as well about, getting an Asian perspective of education as well, because we tend to home in on the kind of black the black community, but it's also Asian community that we have in Baines as well. So I know the mosques are always very keen to engage and give their perspective as well on these things. Yeah.
Thank you, my colleagues. Confirm that we are working closely with that particular group, and we appreciate your comments. Thank you.
Thank you. I think that's a very in-depth conversation that we've had on that item. So thank you, everybody, for your participation.
Yeah. Could I ask a question, please?
Another question.
Not of our people, a governance question. This is going to go through to Cabinet, and then it's going to go through to the Council. Is there, and you started off by saying there were concerns, just in terms of how we deal with this in governance terms. Jean's made mention that we've got a working party in this month. Is what issues, there's been a lot of scrutiny. Are there any significant changes that you actually require of this plan for us to consider?
Thank you, Paul. Yes, just to clarify, and my apologies for inadvertently confusing matters right at the beginning, but I think the key takeaway would be if we could have an executive summary at the beginning, and if we can have the percentages also given as actual numbers. I think that would help us no end. And I must admit, I wasn't aware that this report is done to a very specific template, but perhaps your feedback to the powers that be could be that in terms of scrutiny, it's not necessarily as clear for us as it could be. But perhaps this will change with the new government and with the reduction in bodies such as the Police and Crime Commission as we move forward. But thank you, Paul, for reminding me.
Thank you. Much appreciated.
I think I would also say the equality impact assessment, certainly on the actions, needs to be clearer and more detailed and robust.
I don't know if you heard that. That was about the equalities impact and actually what is the impact of such a report and how is that met within the plan. Thank you. Okay, so we now move on to the last substantive item, which is the IRO's annual report. I think, Councillor May, you're going to introduce this, and I think, Sarah, you're going to hopefully be available to answer some questions as we move forward. So, Paul, is there anything in addition to the report, which I'm very glad to see here, but I think in future we would like to see this before it goes to corporate parents? Getting that in first.
Thank you, Chair. You've taken me out now. I wanted to make that point. The corporate parent meeting was last week, where Sarah did a full presentation to the people who were able to attend, because there were a number of apologies, quite reasonable apologies. But it is, the process really should be scrutiny first, then corporate parents, and then the formal approval moving forward. So in the past, it's been a little bit, Sarah's come along and everybody sort of makes their comments and then they just go on. But I think talking to Jean, the governance behind this needs to be strengthened a bit moving forward. So we're going to take that on board in the future. It's just this time around, it's the two have actually got in a different order than we would like. But at this point, I think the independence of Sarah and her team is really important. And there was a good discussion on, was it Friday? Thursday, whatever it was, last week. So over to you, Sarah.
Only to give us any sort of, anything that's not in the report. So just because I think we'd like to move into the questions sooner rather than later.
Oh, there you go. No, it's okay. Sorry, that's my error. Apologies. I'm Sarah Hogan, Head of Service, Children's Quality Assurance and Safeguarding. I'm the manager for the Independent Reviewing Service and the author of this report. I don't have anything additionally to add. It's a very new report that's just recently been completed, and as Councillor May said, was presented at Corporate Parenting last week, which is unusual. It does usually come here first. There were some challenges, I think, with kind of dates, and as we said, we are going to address that in the future. But nothing new to add to the report, so happy to take questions.
Thank you very much, Sarah. Right, any questions from my panel? Liz.
Thank you, Sarah. I did ask a number of questions at a corporate parents meeting, but I thought I would just revisit one or two because I need further clarification. You talk in the report about the dispute process, sorry, I'm just looking for the actual terminology, but it's about the dispute resolution process and how there needs to be greater scrutiny of this, and that there were 100 instances when this was brought to attention, because it looked like quite a number, but when we interrogated this at the corporate parents, it looked like there were some of the cases went forward, so it wasn't quite 100. But you did say in your report that there should be greater scrutiny by senior management of the dispute resolution protocol. And when I looked back at the report in December, because there are a lot of things that carried on from December and haven't quite changed, you said that as well. So when I asked you, it was going to be set up. So my first question is, has this actually been set up, that this dispute resolution process, I'll get there eventually, is that there are these monthly meetings so that senior management can keep an eye on what's happening? And I think two of the main reasons for these dispute resolutions being brought forward is that there needs to be that the reports from social workers weren't presented in time. There was a lack of information for assessment. So that's my first question. Thank you.
Thank you. Yeah. So I suppose there's been some changes at kind of senior management level in the last 6 months. So we used to have head of service liaison meetings where I would meet with my counterparts and we would talk about the use of the dispute resolution protocol. We now have the introduced senior management team meetings that are held monthly. And so as of August, I'll be taking a report to those meetings. I've put it on the agenda. I think our next one is on the 6th of August, and they're held fortnightly, but once a month the proposal is to take to there a summary of what the use of the dispute resolution protocol is, and to kind of highlight whether there's repeats like themes in terms of children or in terms of particular aspects of a child's care or care planning. They are also reviewed monthly by myself and the IRO service, so we look at any of those that remain outstanding or unresolved. So there is scrutiny of them, but we want to kind of strengthen that with the new arrangements around our senior management team and the changes that we've got at a senior management level. So hopefully that answers that question for you, Councillor.
Thank you. Back in December, you said that it's the timeliness of social work reports which hold up your IRO reviews, and that in December, 38% of reviews were within the 3 days of when they were needed. And you've said that that has improved. Has that improved? And if so, by how much? And is that still an issue that the social work reviews are missing from when you do your IRO reviews?
Yeah, thanks. So I know Scrutiny is asked year upon year around the completion of social work reports, which is probably why it features quite heavily in this report. I know last year there was a lot of discussion at Scrutiny. So currently there is no data report that I can access that on a day-to-day basis I could identify how many reports are outstanding, how many are due. So in supervision with IROs, which is monthly, we review all records. So I do have data reports that show any reviews that appear to be out of timescale. So I discuss those with IROs at every supervision, and then I can get a baseline around which of those are actually out of timescale. They're not, it's because the social work report's not completed. And in those instances, I would raise that directly with my counterpart in children's social care. That has definitely reduced in terms of the frequency in which that happens. So those discussions in supervision, I'm not seeing the same kind of frequency of reviews appearing as out of timescale because of social work reports. There may be other factors, but largely we are seeing an improvement, and that's what collectively the IRO service, the IROs within the service report. They have peer supervision kind of every couple of months, and they do look at themes, and social work reports hasn't been a theme that they've picked up. I can't sit here and give you assurances from a data perspective because I don't have that data, but from a kind of lived day-to-day management oversight and discussions with colleagues, and because where reports do remain outstanding, they do get escalated to me if they can't get resolved, I'm seeing less of that. So I do feel like we're on the right trajectory. One of the areas that we're looking at is how we can develop a data suite that will support the IRO service, and with the national reforms in terms of families first and the changes, and I commented at corporate parenting last week that in Bath and North East Somerset we have independent chair role which encompasses the IRO role. We'll be separating the IRO out in the future, so the proposal is that from November we'll have an IRO function, role and responsibility. It won't be combined with another role, and so I think there's an opportunity there to look at kind of what data we can get for that service alongside all of the other data that we're looking at that we're going to have to report onto the DFE.
And I was going to ask something about Families First, the Families First programme, and you already mentioned back at Corporate Parents, we did explore the fact that the head of service was going to be split. But are there any other factors that are going to be affecting the IRO service from Family First?
No, currently the IRO service sits within Safeguarding Quality Assurance, and I'm the head of service for Safeguarding Quality Assurance. Obviously, we're still in formal consultation, and that hasn't concluded. But it's proposed that my role will remain. The IRO service will sit alongside the multi-agency child protection team and the local authority designated officer. So there is a real similarity in how the service is delivered. I think for children in care, it's really positive that we're going to have a sole IRO role, because there is always tensions between kind of managing that competing demands that an IRO has in terms of seeing children where they live, but then equally having oversight of children who remain at home with their families where there's significant risks.
Thank you for sharing with us. You're going to be part of the multi-agency group. Thank you.
Thank you. Are there any other questions? Kevin.
Thank you, Chair. Thank you for the report, Sarah. The first point is a very minor one, but it was just clarity, really. On page 118 in your contents table, I presume the last line is summary and area for development 26-27. I'm only presuming.
Apologies, yes,
Okay,
it will
no.
be, yes, sorry.
So the question bit, just to show I've read it, really, that's all. So the other questions around are on page 132, about children placed outside of Baines more than local authorities nationally, outside of Baines boundaries. Are we currently doing anything on this? And are there particular reasons in our authority? And I know there's lots of things happening, whether it's specialist provision putting elsewhere, but are we on track to change that at all? The next question is around placement stability, and is that tied in any way with possible questions around new children's homes, places and things in Bath, North East Somerset? The next question is around the virtual school and how that, or does it, fit in with child in care reviews. Will the IRO service shape in any way the new regional care cooperative if it comes about? And is it playing a role at the moment in sort of area around placements and sufficiency there? And in the equality impact assessment, you mentioned that there is no IRO statutory involvement post-18, but I was under the apprehension that at one point in time you played a role in supporting children in post-care, or was I totally in a different world, that they could request support still, and you were part of that support? Obviously not. Thank you.
Sorry. Yeah, so apologies if I haven't captured all of that. So I will absolutely amend the contents page. Thank you for your critical eye, that's helpful. In terms of placement sufficiency and placement stability, so in terms of placement stability, I think you made reference to the proposals around the Charlton House. Is that what you're referring to?
Sorry. In other meetings, I thought there were some considerations for increasing children's homes, places within Baines.
So placement stability and placement sufficiency are interlinked, because obviously if we haven't got the appropriate placements, and what's most important is that children are placed where they can feel held, safe, secure, where they can kind of recover from the trauma and their kind of adverse experiences that they'll have had. And so it's really important that they are placed somewhere where they can get the care that they really need in order to help them overcome those challenges that they've faced. There are occasions where children do end up in a residential where that isn't the ideal, but that's kind of actively worked upon to try and find them the right placement. So sometimes children are placed where the IRO and the social worker will all be in agreement. This isn't a long-term option, and so we envisage that there'll be future moves for those children because we want to get them the right placement, the right care arrangement. So some of that placement stability we'll go into knowing that there's going to be changes ahead. Some placement stability will be because once children are in care, it becomes more evident what their levels of need are, and actually that placement isn't the right placement for them. There is a lot of oversight, and I would say, you know, I've been the head of service in this arena since 2018, and I've seen a lot of transitions of children and concerns around kind of placement stability and sufficiency. And the IRO service has become more and more embedded in overseeing those children where there are concerns about placement stability and not finding the right placement for them. And so IROs are part of kind of regular meetings with social work teams and also those providing care to those children to think about what else we could do to support. I think there is a huge amount of scrutiny and has been consistently, I would say, since kind of October of 25, more so than we've had previously, to really think about placement stability and sufficiency. IROs aren't involved in the... oh, sorry, no, your next question was about virtual schools, apologies. The head of virtual school and myself have regular kind of, you know, the fact that we're all sat in the same office, so we can kind of have that ongoing dialogue. The IRO service is very visible to the virtual school, and IROs will go directly to virtual school if there are any matters arising in relation to a child's education, training or employment opportunities. IROs will always ensure that children have had their PEP meetings, they'll have reviewed that as part of their child in care review process. They will escalate and highlight to the virtual school team any concerns around education or training. We have an open kind of discussion with virtual school if we want to invite them into our team meetings. I do sit on the virtual school governors board, so again can kind of get some understanding and scrutiny of our virtual school offer. So we're very kind of, you know, we have a very similar remit. It's about kind of making sure needs are being met, and so Sarah Gunner, who's the head of virtual school, and I do have lots of conversations, but equally so do the IROs. In terms of IRO's involvement in the care cooperatives, we haven't had any involvement in that, and I'd probably defer to Jean or Paul to bring that to life a bit more. And you are right, in 2019, I think that we muted around post-18 and whether we could provide an offer, but that didn't actually ever happen. It was something that was muted. I think partly COVID probably was a kind of distracting factor, quite a significant distracting factor. But I think also IROs at the time, we had a long conversation about what that might look like, and it's really difficult to, like, where is your role when your statutory role doesn't extend beyond 18, and also from a capacity, and how do we make sure that the children in care that do need that IRO oversight remain the focus of the IRO service. So that didn't actually come to fruition, and at the moment there are no discussions about that kind of being revisited.
Thank you. Jean.
I'd just like to come in on a couple of those points. So to the last point that Sarah has spoken about in terms of post-18 support for care experienced young people, of course they are allocated a personal advisor, and currently that is a requirement up to the age of 21, but the Children's Wellbeing in Schools Act extends that to an offer much more formally enshrined in legislation to 25 to support young people who are care leavers to stay close to the local authority. So that requires us to think about accommodation, education, employment training, their health and well-being support needs. Of course, young people over the age of 18 can say no thank you. So there isn't currently a statutory duty to support from an independent reviewing officer oversight of their pathway plans, because after 18, care plans become pathway plans, but it's the personal advisors that will oversee those pathway plans. So we have a mechanism already to make sure that young people are well supported. And also, if young people are very vulnerable, we would refer them to adult social care for a Care Act assessment in order to think about their post-18 support needs as adults. So I wanted to say something there. And then the second point speaks to the placement sufficiency work. So the intelligence that we get from our IROs is incredibly important in thinking about what's working and not working in terms of placements. But more generally, we have been working on a detailed needs analysis to develop a placement sufficiency strategy that will really help us think about what do we need locally. Is it more children's homes beyond Charlton House? Is it a real development of our fostering and kinship offer? We think it's probably a combination of those things, but in addition, we also need to think about support for young people who are 16 plus, who don't necessarily need a foster home or a children's home, but may need more semi-independent accommodation. So we need to think across those types of care as to what we need, and we're still undertaking that work. We are looking at some bespoke a bespoke role to really deliver that at more pace, so that we can be really clear about what we need to do. So it's an ongoing piece of work, and we're certainly happy to come back and present further on that in due course. We'll certainly be talking about it at Corporate Parenting Group.
Thank you very much, Jean, for that additional information as well. Leslie.
Yes, thank you for the report. It's very interesting. I'm really pleased to see on the Equality Impact Assessment there's work to be done, and also a report coming back to this committee in November about engaging with children, which is clearly very, very important if we're going to make sure that they can have some impact on the future work that we do. One thing that does come out of this is that it says in the report that we've got increasing numbers of children coming into care, not just this year, but the year before. So how do you see us managing to reduce that? I also note that there were not many social work reports completed within statutory timescales. How are we going to address that? And something else occurred to me that you may not have the answer to, but do we do training around the social model of disability within the council? Because I'm just wondering if we're taking the right view of disabled people. I'm just getting the feeling that we see them as being a problem rather than the system being the problem. Thank you.
Thank you. And I think the middle question, I think you answered previously when you were answering Liz. So, yeah, but it'd be interesting to hear what you have to say on the other points.
So in terms of engagement with children, we've reached out to our off-the-record colleagues. So Charlotte, who leads on advocacy for children in care, and the In-Care Council Junior, In-Care Council and Senior. And we're looking to re-establish a link between a link IRA with that group to foster a greater communication and kind of two-way dialogue as to children's experiences of being in care, but also particularly around the IRA service. Charlotte grabbed me at the end of corporate parenting last week to kind of say, we get loads of positive feedback. We probably need to think about how we feed that back. I sometimes work on the premise that no complaint is positive, but equally our service does need to be shaped by children's experiences of it. So that is something that we absolutely have already kind of put wheels in motion to progress. In terms of our increase in children in care, so I think I touched upon this briefly in my report, that the Families First programme and its aim is around kind of prevention and early intervention. And local authorities, nationally are looking at how we can keep children at home, how we can support families, how we can get in at the right time and in the right way to affect change so that children don't end up coming into care. But for some children, they will continue to need to live outside of their kind of immediate family. But it's about ensuring that we kind of, I think Jean commented upon this earlier, that, it's about looking at other options. It's not always around local authority, but connected persons, kinship, etc. So I absolutely agree that there has been a kind of that increase, and if we continue at this kind of pace, then there will obviously be greater numbers in the future. But I do think that we have a real opportunity now with how we're redesigning our services to make a difference to families and to prevent. And I would hope that kind of, in several years' time, we'll be looking at a very different picture. There's certainly a commitment to across the partnership and across children's services to think about how we work with families and to hear directly from families. So we have a participation group, so families who have got lived experience, informing our plans for Families First, and that's kind of, that's crucial, because there's no point us sat at our desks designing a service that we don't have experience of. And I think it's really important that our services are led by those that have received them, so that we can improve them, strengthen them, and ultimately make a greater difference so that their children kind of remain within their families and safely, and that's where they grow up. I'm not going to comment on the social work reports because I feel like I have already answered that question. And I'm really sorry if I could just ask for the last part around children with disabilities, just to be clarified, because I'm not sure, there's a lot of seagulls. I couldn't hear very well, sorry.
I know they could be loud, can't they? No, I don't think the question's actually to you, Sarah, really. It's about our organisation and do we use the social model of disability or do we not, and do we do training around it so people understand it? Thank you.
I think that might be a question more for Jean than for Sarah. Or even for Paul.
So I think I better answer. We've got an equalities officer in Bath, North East Somerset, and I meet Leslie on a regular basis to try and pick up the equalities issues and the disabilities. I've got a hearing disability, as I think Liz has as well, and we've got hearing loops that have been put in a few meeting rooms. So as a local authority, we also went out to the LGA to do a review around our performance, and one of the key issues there was around making sure that we are more inclusive as a local authority, and that's certainly in our plans moving forward about the inclusivity. So I think it's a wider issue, and it would cover adult services and children's services, but I think Councillor Mansell is going to regularly challenge us, and I think that's right and proper, and that's absolutely the right of the Scrutiny Committee to do so.
Thank you. Thank you, Leslie, for your questions. Okay, so I'm now going to draw that item to a close. Thank you, Sarah, for answering all of those questions. Next is the minutes of the 22nd of June. Are they broadly an accurate reflection of that meeting? If anybody's name was spelt incorrectly, could you let Mark know? Kevin, was there anything else you wanted to add?
Well, only that obviously the statement on page 10, item 21, is that you just have to add that little bit. The minutes were agreed, subject to. Yeah, thanks.
Of course. I think that's usually a given, but we can make sure that that is clearer in future. So is everybody happy that I sign those as an accurate record then, apart from Leslie?
Could I just make a comment on it? I know we don't normally do other business, but in respect of the privatisation at the RUH, there was a rally there on Friday. I went along. There was nearly 100 people turned up. And some of the interesting things were from the bank workers themselves that were saying, as we predicted, we're not going to sign up to the new contract. We've been all through this before. We don't want to do it again. These things go out, come back in, because they don't work. So, well done for everybody that turned up.
Thank you, Leslie. And so I will sign those, and thank you for that extra information. So our final item, well, almost final item, is the panel work plan. Obviously, we have what's before us. We've got a number of items that have come up through the course of this meeting, including a visit to Abbott Alfridge. Also, the discussion about being more aware of our role as scrutiny in health decisions. I think we've got that we would like the Oxford Health Plus off the record and other organisations to sort of inform us of that joint working. Was there anything else that's come up from this meeting or anything else that you'd like to see on the work plan? Liz?
Have you got the details of the SEND reform plan to actually get that when we get the feedback? And also to do with that as well, the area SEND inspection report. Yes. To receive that.
Okay, thank you. And in addition also, we wanted the regional director to come and attend our next meeting with Children's Focus. Any other items?
Sorry, Chair, that was both education and social care, because there's two separate regional people.
Oh, sorry, regional education. I was talking about maths with that. Yes, sorry. Okay. Yes, Liz?
Could we have the free school meal auto enrolment update? How successful was it? What lessons need to be learned for this coming year?
Yes, and I'd like to add into that any changes because of the way that pupil premium is now allocated. So I think that would be really important because it was always an incentive, wasn't it, to encourage schools to get more children who were receiving free school meals to be registered. So that's the way around. But David.
Yeah, the Oxford Health thing was also about access to CAMS and child developmental assessments, etc. So,
thank you. Yes, John. It's better to have couched it in those terms than the way I put it, which was badly done. Joanna?
I'm never sure if this is the right committee. I've got three things. Dogs. We've got lots of residents who are not well looking after controlling their dogs well, and about the policy around that and what that is.
I don't know offhand, but I am quite certain it's not this panel. We will find out for you which is the right panel.
But I do think there needs to be a piece of work around that, because it's coming up a lot, and I've heard other councillors mention this. The other one is noise, so the environment protection. So if people are making a lot of noise, it's not a police matter, it's a council matter. And again, how do we judge when noise is a health and safety issue, and how do we protect people around that? So does it sit into this?
Yeah, I agree with what Kerry's telling me, that it's not, it's a regulatory function, and so I would say if you want to look at the policy around it, that's going to be in the climate emergency panel and not this panel.
Could it go to them anyway? Could I ask that to happen?
You can ask that it happens, but obviously it's in the chair of that panel's discretion to take it.
But I do think that it'd be useful for everybody to understand where they stand as a councillor when they get complaints, and where do we sit, and how many reports do we have. There could be a piece of work
again,
around
it is something that I think would go to that panel, not to this panel. You said there were 3 items. What's
yes, and the third is with social housing providers following full council. There's clearly a piece of work around where we are with social housing providers, what the complaints we are raising to them individually, and if there should be a piece of work around the council collecting up that data, so we all know that, 57 of us have been to a particular social housing provider on this issue, whereas at the moment we're all working very autonomously, and there is no containment of what's going on, and I think there could be a piece of work around that.
Okay, so 2 panels there. One is going to be the climate emergency, and I understand Cura already coming to speak to that panel at a future meeting, the date of which I don't know. And then I think Health and Wellbeing Board has picked up issues around social registered landlords previously, so depending on what the issues are, that might be another avenue, but I'm sorry, Joe, it's not coming to this panel. Any other items for the panel? Otherwise, we will, if there are more things, then we will pick those up as you ask us to. And then my final thing that I want to say, and this is really quite sad for us as a panel, is that Chris Batten is going to be leaving us. Christopher Batten is going to be leaving us, which I think is quite sad, because Christopher has been on this panel, or a form of this panel, for at least 25 years. So I think we should recognise his commitment and his contribution, and as we say goodbye. So thank you, Chris. I don't know, Chris, if you wanted to make any sort of speech.
No. Just to say thank you very much for your friendship, and wish you all the best in the future.
And we'll be available to watch on webcast if you wish, Christopher.
Eras.
Paul.
Chair, could I just formally also say a big thank you to Chris. In a former life, I was the first Chief Executive of North Somerset Council, and my dealings with the trade unions there shocked me, because they were highly professional, highly reliable, and Chris was a really, really key partner in development of that particular area. And it was great when I came into this council to see Chris sat there with that continuity. So I've known him for over 25 years, and he's been a great, great advocate for children in the whole area of Bath and North East Somerset and North Somerset.
Thank you, Paul.
Can I reply? It just happened that at that particular time, education was in the hands of councillors, and we were protesting about education not getting their fair share of the budget. And we were marching around the town hall as it happened. But Paul happened to be the chief executive at the time, and we got to know him very well then.
Thank you very much, Christopher. And as I said, you know, we will miss you and we will miss your valuable contributions, because whilst you don't always speak, you invariably have something very pertinent to say when you do. So we will miss you. Thank you. And on that slightly sad note, I will now declare this meeting to be over, and thank you everybody for your attention and your contributions.